Thank you, Mr. Gaines. I'm going to call this meeting to order at 7:01 p.m. This meeting will be conducted in accordance with State of California Executive Order N-29-20 dated March 17th, 2020, and State of California Executive Order N-08-21. All members of the PSAB are participating in this meeting by video conference with no physical meeting location. Members of the public wishing to observe the meeting live may do so on YouTube at mountainview.gov/YouTube or through this Zoom webinar. As noted on the meeting agenda, members of the public may provide oral public comments online during the public comment period for an item through this webinar or by phone by dialing 669-900-9128 and entering webinar ID 910-3199-5528. Any emails received by 4:30 p.m. today were forwarded to the PSAB. Emails received after 4:30 p.m. will not be read during the meeting, but will be entered into the record for the meeting. Mr. Gaines, can you take roll, please?
Yes, Chair Iyer.
Present.
Vice Chair Frink.
Present.
Member Brodowski.
Present.
Member Langton. Member Langton is here. He's on mute. Member
Present.
Thank you. Member Tang.
Present.
Member Wang.
Present.
Member Sandhu. Member Sandhu is not here.
Thank you. Let's move on to item 3, which is oral communications from the public. This portion of the meeting is reserved for persons wishing to address the subcommittee on any matter not on the agenda. Speakers are allowed to speak on any topic for up to 3 minutes during this section. State law prohibits the PSAB from acting on non-agendized items. Would any member of the public like to provide comment on an item that is not on the agenda? If so, please click the raise hand button in Zoom or press *9 on your phone. You will have 3 minutes each for your comments. Okay. All right, Mr. England, please go ahead.
Thank you, Chair. 2 things really fast. One, those of us in the community working a lot on this topic or on the topics being covered here have been able to meet with all but one of the PSAB members. So just want to express my personal appreciation for those of you who accommodated requests for meeting. And those were very useful. All the discussions there were useful. And then second, I didn't see the SRO subcommittee report back on the agenda file. I would have expected that. And I know members of the community would like to know what the subcommittee is working on since those meetings aren't public. Unless I missed it, I don't think it's there. Thanks.
Thank you. All right, I am then going to check in with Mr. Donnelly. Please go ahead.
Yes, can you hear me okay?
Yes, please go ahead.
Okay, great, thank you. So I'm Seth Donnelly, and I've been teaching in the Mountain View Los Altos district for 21 years. I was calling to I'm sure that there's been a bunch of stuff in progress on the SRO issue, but I wanted to add my voice to urge this body to recommend the removal of SROs from Mountain View High School. I teach at Los Altos High, and that was done by the city council last spring, as you probably are aware. I think it'd be very important for Mountain View High to do the same, since there's pretty major issues with that program, and particularly students of color feeling comfortable on our campuses, just as that issue is occurring all across the country. So I would really urge that you recommend to the Mountain View City Council a similar removal so that we can reallocate resources towards better measures that more proactively address public well-being and public safety. Thank you so much.
Thank you. 2 quick things. I want to recognize that Member Sandhu joined the meeting at 7:05 p.m. And Captain Canfield, I wasn't sure if you were doing timekeeping. I realized I should have asked earlier.
I am, and I will raise my hand and I'll show you when there's 30 seconds left of
Okay,
the 3 minutes.
awesome. Thank you so much. All right, I'd like to move on to Kiyoshi Taylor. Please go ahead.
Hi there, can you hear me?
Yes.
I actually had Mr. Donnelly as a teacher back in the day, terrific teacher. But I'm also calling in on the SRO issue. Over the past year, Mountain View and Los Altos has gathered an abundance of information on how this program has been adversely affecting many youth of color. With everything we've learned about racial disparities within our own community, it's time we act and join many of the other districts that have removed SROs, including San Jose School Unified, who just did, which is a giant school district. I know this town likes to talk a lot about, well, we're not like this city or we're not like this town. There's been towns smaller and there's been cities larger than us who have gotten rid of police on campus. So not only does that excuse no longer fly, but it's also time we start looking for new ways to give students, and especially students of color, proper resources, such as counselors, therapists, to better cope with some of the issues that are happening on our campuses instead of continuing the school to prison pipeline. Unfortunately, a lot of people of color in this town don't feel like they have a voice, but we've collected plenty of data. If you go to justicevanguard.org, you can find plenty of testimonials on how SROs have negatively impacted our community members, from students to the teachers working there. I highly encourage you guys to reach out to us, as well as watch all the testimonials and read everything we've made public, so you guys can make a hopefully proper decision in removing SROs and joining the rest of the Bay Area in the future of public safety and education. Thank you.
Thank you, Mr. Taylor. Mr. McKenzie, please go ahead.
Greetings, board. Thanks for giving a moment to speak. My voice has already been heard through the past month several times on calling for SROs to be removed from school, so I will not belabor that point. I will just ask, how many times are we going to have to make community members mobilize to ask for them to be removed? I just wanted to add my support to the people who have mobilized tonight, but actually, what I wanted to mention in this brief period is something that I saw last week in the Mountain View Voice. There's SB2 is a state bill that is moving through, which is a state bill that would allow California to decertify police officers. According to the Voice, we are one of only 4 states, I believe, if I'm remembering correctly, that does not have a process to decertify police officers. And I know we love to say in Mountain View that we are better than in the other cities. So obviously we wouldn't want to accidentally hire someone who is not really suited to be a peace officer. So it would be great to have a method to decertify officers. There is a bill going through the state legislature right now, and the Public Safety Advisory Board in our city seems like a great place for us to raise our voices as a city and say, this is something that we can do to make good policing happen. So I would love to see the board come out in support of this bill and advocate for city council to do likewise. Thank you very much.
Thank you. I want to call on Keenan, and I apologize if I'm mispronouncing your name. Is it Moose or Mose? Might be something different. Please go ahead.
Good morning. It's Keenan Mose. You were close. I appreciate it. I am a person who grew up in Mountain View and then moved to Los Altos, and I graduated from Los Altos High School in 2016. I've already had to speak up a bunch of times in Los Altos and in other areas to speak about the really bad relationship and experiences that I had with SROs on campus, from them targeting me, making me feel uncomfortable, and doing the same thing to my younger siblings. It's not a thing that is only happening here. I mean, everyone's calling from across the country. And I think it's time that we realize, as good as we think we have things, we really don't. And there's a lot of people in this community that we've been ignoring and taking voices from. So it's time to start listening. We've had our youth speaking up more than ever in the past year. It's time that we remove these cops from campus. It's just ludicrous to me that you'd have an armed person on campus be like, that sounds logical. Let's have that around our children. When there's people who go to school professionally to work with mental health problems, to work with children, to work with people with disabilities, to work with people who are trying to learn. And they're way better equipped to be able to help these students, not someone there with a gun. So please remove SROs. Thank you.
Thank you. Let's see here. Chris Lytle or Little, again, apologies for if I'm mispronouncing, please go ahead.
Hello, can you hear me?
Yes.
Yeah, and it's Lytle. You're good. But yeah, hello everyone. I'm a alumni of Los Altos High School, and I grew up in the area. I'm still living here. I'm calling in about the SROs as well. So we need to listen to all the local activists and those who've been speaking out for the past years on these issues on SRO removal. Police relationship shouldn't be dealt with on campus, especially with everyone we know about the schools to prison pipeline. Listen to those who are most adversarially affected by the decision. We need to give our students resources that don't walk around with a badge and a gun. We don't need to look further than all of the districts around us and see what they are doing with the removal of SROs. And I've had members of my family who have mental health problems and have had bad relationships with SROs, and does make a really toxic like school environment. So I think that we need to take next steps and finalize moving on SROs. Yeah, thank you.
Thank you. Ms. Mose, please go ahead.
Hi, thank you so much for the opportunity to speak tonight. My name is Tony Mose, and I was a member of the Los Altos Police Task Force that ultimately led to the removal of the SRO on the Los Altos High School campus. It took us numerous town halls of listening to community members, especially children who attended and currently attend Los Altos High School and Mountain View High School, where they finally felt like they had a voice and were able to relate some of the interactions, negative interactions they had had with SROs on campus. After our 6 weeks of research, the police task force ultimately recommended that the SRO be removed from the Los Altos High School campus. And that was after hours upon hours of speaking to community members, as well as doing research nationally, including the data that we have found about what the impact has been on students of color having an SRO, an armed officer on campus. School campuses should be safe havens for all students. If one student is uncomfortable and not able to fully engage and learn, that is one too many students, and that SRO needs to be removed. As others have said, we need to invest in other alternate forms of interacting with students, such as restorative justice programs. Schools are institutions of learning, and if some students are triggered by the presence of armed officers on campus, then the solution needs to be to remove those officers. Many schools are doing it just for this reason and moving forward with restorative justice programs and investing in mental health professionals who have the training and are better suited to deal with students who are experiencing either trauma or other social issues and mental health issues. 40 hours of training is not enough and a SRO is not equipped to do it. Thank you very much.
Thank you. Oops, give me one second. And let me just see if there's anyone else. Last but not least, Miriam Connor, please go ahead.
Hello. I mean, I am last. I might also be least. Hi, I'm Miriam, a 3-year Mountain View resident. I live in the Rex Manor neighborhood. I'm also calling in support of this proposal to remove SROs. And I know that we do have this subcommittee that's doing good work on it, and I would love to hear their update. I've had the chance through MVPDX and other forums to hear from the SROs, learn about the program. I do think that there are individuals who do care about kids, do want to help kids, put themselves out there for kids. I also think that that there are a different resource would be better. I think more therapists or more counselors would be who have more training and more expertise specifically in working with children and youth. We would better serve our schools. So lots of respect for the individuals in the program, but I do think that it may no longer be the right thing for our schools. And just, I wanted to echo some of the points made by earlier callers. So thank you very much. Maybe it was the least amount of time, except I think Bruce's was shorter. Okay, thanks.
Thanks. I thought you were last, but Miriam, Alex Brown needs to have the last word. So Mr. Brown, please go ahead.
Yay! I love being last. And Miriam definitely is not least. I also would like to just support all the people calling for, a school for the city that focuses on the needs of the children and minimizing harm to children, because they're there to learn, and that should be the focus, but also listen to the people who are impacted by all the policies in schools and the funding of schools. And now I get to be least because bye.
Okay, and with that, I do not see any more raised hands. So we will close this item, though actually one thing before I close the item, I just want to express my appreciation for all of the folks who called in and gave their time to provide public comment. I'd like to repeat what I heard. Thank you, Bruce, for your appreciation for PSAB members who have been available for public meetings. I heard you on your question about being curious about what is the latest with the subcommittee, the SRO subcommittee, and do they have a report, and why is that not on the agenda? I also heard many of you talking about the experience of students and the impact that SROs have on them, and calling for SROs to be removed from Mountain View High School because of their negative effect on students of color, students who get triggered. And I appreciate hearing the experience of the Los Altos Police Committee and the way you went about reaching your decision. And finally, thank you for making us aware of SB2 to decertify police officers, decertify police officers when certain things happen. And I heard you about wanting the PSAB membership to support this, and also encourage council members to support it as well. So just want to make sure that you know that you were heard. Thank you again for your comments. And with that, I would like to move on. I would like to close oral communications item and move on to discussion action items. So in section 4 of the agenda, the first item, 4.1, is approval of the PSAB meeting minutes for July 22nd, 2021. Does anyone have any comments or questions about the July 22nd meeting minutes? Doesn't appear that anyone has questions. Oh, Mr. Gaines, I have a question. Do I open this to public comment?
No.
No, thank you. I didn't think so, but still getting used to this. Okay, does anyone on my screen have any questions or comments? Okay, then would anyone like to make a motion to approve the July meeting minutes? Okay,
I motion to approve the July
okay,
meeting minutes.
okay. Could I?
I did put a hand up too, but I will second it.
Okay, I'm sorry, Member Sandhu, did you have a question or comment?
No, when you said who wants to, so I right away did it, but never mind. Derek spoke, so that's fine. I will second it.
You can second it.
Yeah,
All right.
thank you.
And Mr. Gaines, from my understanding, can a motion be a hand on the screen, or do you have to hear it verbally?
I prefer to hear it verbally.
Okay, so going forward, everyone, please take yourselves off mute if you would like to put a motion forward. Okay, so all those in favor, please raise your hands. Okay.
Chair, so you know, because I was absent, I will abstain from this vote.
Okay, thank you.
Through the chair, I'll do a roll call vote just to be clear. So we had a motion by Member Langton and a second by Member Sandhu. I'll just go by name. All in favor, Member Sandhu? How do you vote?
Aye.
Aye.
Member Tang?
Aye.
Member Wang?
Oh,
Aye.
Member Langton?
aye. Sorry.
Member Rodofsky?
Aye.
Member Frink?
Yeah.
Just smiling?
Do I have to say something? I'm abstaining. 'Cause I was absent.
Thank you. I'm trying to be formal here.
I understand.
So that motion passes.
Okay. All right, then let's move on to section 5 of the agenda. We will start with section 5.1, which is an update on the mental health crisis responses. This item will include presentations by 3 people, Jan Morale and Sandra Hernandez from the County of Santa Clara Behavioral Services. And then we will move on to Captain Saul Yeager. Hello, Ms. Hernandez. And Ms. Morale. I'm not sure if you're presenting together or if one of you is taking the lead, but thank you for joining us. Welcome, and please go ahead.
Yeah, good evening, everyone. I'm going to turn it over to my colleague, Sandra Hernandez, who will start off our presentation. Oh, Sandra, I think you're muted.
Thank you, Jan. Thank you and good evening. I just wanted to thank you for inviting us to present this evening about our crisis services that we provide in Santa Clara County. So I'll be speaking about the mobile crisis response team and then hand it off to my colleague, Jan. Thank you. Next slide. You can go on. So I'm going to be speaking about what MCRT is, and that stands for Mobile Crisis Response Team. And it's a program that started back in 2018. And it was really something that started as a result of all the officer-involved shootings that were occurring, particularly in our county at that time. But as we know, things have continued on in not only locally but statewide, and it was a concern that the behavioral health community felt we needed to address. In addition to that, there was high levels of incarceration and hospitalizations that were of concern as well. And we realized that people were not going to receive the services they needed through those types of interventions. And so MCRT was designed to help alleviate some of these situations and look for ways to de-escalate situations that could lead to potential hospitalization or jail. And so that's what MCRT is about and why we really do exist, because we really want to address the behavioral health concerns and really not steer people towards inappropriate levels of care that we feel are not really care. They're really more institutional types of care that are really not care. So that's why it exists. You can go on to the next slide. So what the mobile crisis response team does is we provide in real time as things are unfolding crisis screenings. We can do that by phone. Generally, it is oftentimes starting with a phone call, and we do crisis assessments, interventions, and de-escalation. We do a lot of verbal de-escalation. We do a lot of linkages and referrals because that's just as equally important for people who are in crisis. They just don't know where to turn. And so we want to make sure to give them resources that really fit their needs, not so much, again, that it's going to lead them into a direction where they're going to end up either in a institutional type setting, but it's something that they could be managed very easily with the right connection to the right provider who has the resource that they're looking for. And then just a lot of good consultation, as well as any kind of disaster response. People are available for that as well. But this is a lot of sort of the basics of what Mobile Crisis does on a daily basis. And they continue, it's a 24-hour program, so it's done all the time. So next slide, please. So when we think about a crisis, particularly an acute mental health crisis, there's several, there's a definition that we really want to make sure people understand, because this is the legality of what we call a 5150, or some people will say a LPS hold. What it is we really have to base information that we're receiving on a current presentation, as I mentioned, real time, what's happening right in front of us. And it's to assess people for what we say danger to self, danger to others, and then grave disability. I think the danger to self is rather obvious. It's for folks who are really in the throes of a crisis where they're feeling very vulnerable and suicidal. And we want to address that situation immediately. And if somebody's not able to control their impulses, they have a plan, they've thought it out, we oftentimes have to consider this as an option to protect themselves. Same thing would be for danger to others. When we know somebody is making threats to somebody of violence, not just somebody who, making a threat because you're mad at somebody, but it's because of a mental illness. That is the component that's important here to understand. It's about somebody's mental illness that's interfering with their ability to function, and maybe they're hearing voices, and so they're responding to commands, maybe that, I need to hurt so-and-so because my mother maybe, or my neighbor, because they're against me and they're poisoning me. And so we want to think about it, from that perspective as a danger to others. The grave disability is also can be challenging. Oftentimes, I think people misunderstand when we see people that are on the street that appear like, well, they need a place to stay, and maybe they're talking to themselves. People may think, well, let's put them in the hospital. Oftentimes, it's really not the most appropriate option. But when we look at grave disability, we're looking at that as people who are unable to meet their basic needs, the food, clothing, and shelter, because of a mental illness. It's not just because they don't have someplace to go. They have to be not oriented to their person, place, time. They're not able to advocate for themselves. They're really not oftentimes in touch with reality as what's going on. They just don't understand how they're going to get to maybe some food. They don't have any concept of that. And so those are the folks we would say have met the criteria for grave disability. So that's the criteria we utilize. And again, it's what's going on presently at the time. It can't be it happened 2 days ago. It has to be real time, what's happening at the present time. Next slide. So meeting the client's needs. About 80% of the clients that we do see are not placed on a 5150 hold. That's really important for people to understand, that we do go out, we respond, but not everybody requires to be placed in the hospital. That's, I think, really significant, because that says we are not thinking of people as just needing one option, and that is a hospitalization. We're thinking about what other things could be useful to them that might be a community resource. So we do a lot of linkages and resources. And so there's a little short list here, but we think about the Mission Sobering Center, a crisis stabilization unit. We have a place called Blackbird House where folks can go for period of time, for several days, if they need to have a sort of a place where they can be away and be like a respite for them. We have a mental health urgent care program that is 7 days a week, 8 a.m. to 10 p.m. And that's a walk-in clinic. It's an opportunity where people can just present and say, I something's not right. I need help. Or family members can bring people in and say, hey, my son or my daughter is not acting right. Something's wrong. We've noticed this. Or they've started using drugs and alcohol. So we want to look at those resources. We also have another program that's somewhat tied to the mobile crisis response team, and it's an in-home outreach team, or otherwise known as IHOP. And again, that's for folks who are have a mental illness and they need some support because they don't have housing, and we want to outreach to them and engage them in services so that we can connect them and have them be, involved in services that provide continuity of care. So that's really important as well. And we want to coordinate all these all the time with the mental health providers that are in our community, because some of these people have providers that already they're connected to. They've just lost touch. They may have, left, years ago, and now they are back needing some support again. Families trying to get them engaged back in services. So we do a lot of coordinating with other providers in the community to help them to, get reconnected, maybe back on medication if that's something that they're needing, and just be getting into the services that will be best suited to their needs at that moment in time. So next slide. So who is MCRT? Well, they're clinicians, and they partner with our law enforcement agencies throughout Santa Clara County. So they serve everybody from Gilroy, basically, to Palo Alto. And they're all master's level licensed or licensed waivered clinicians. Right now, this slide says 11. We are in the process of, we've got approval for 6 more codes. We're in the process of interviewing for 6 more people. So that'll be a total of 17 clinicians. So we're really excited about that. We just actually did some interviews today. And so we're encouraged that we may be able to bring some folks on board. So we have 17 codes. We have some student interns. We have on-call staff as well. And then we have 3 law enforcement liaisons who are part of the MCRT program. And they're really instrumental to the work that MCRT does, because they help to bridge those gaps with law enforcement. These law enforcement liaisons are all retired law enforcement officers. Actually, one of them is from the city of Mountain View, Tony Lopez. I think he's maybe on this call as well. And they help to, like I say, work with law enforcement and bridge those gaps that behavioral health and law enforcement sometimes encounter, where we're trying to figure out what's the best solution for this situation. How can we work together? What can we do to not have to hospitalize somebody, not have to take someone to the jail? What can we work together on so that we can meet the needs of the individual and the community's needs? If there's something that we can do to address the situation that will help be a win-win for everybody, especially the individual who's in crisis or in need, that's the goal. We want people to receive services in a humane and respectful manner. And I believe we accomplish that on a daily basis. We really do take into consideration, what are the needs of the individual, their family, and those people who love them. Because they are somebody's family member, and we want to make sure that they're connected to the people that are important to them as well. So next slide. So as I was mentioning, we have law enforcement collaboration. We go 96% of the field visits we go out on, or the team goes out on, are involving law enforcement. Mainly it's a safety issue. We want to make sure things are safe for the clinician when they approach a situation. So they do a lot of meeting up before they approach a situation, discuss how they're going to approach it, what they're going to do, who's doing what, ensure that safety is being addressed, and then they decide to go in at that moment and they work together. And so there's consultation going on. They're looking at chronic cases that Folks who maybe call 911, what they call nuisance calls sometimes, or complaints, they're helping to advocate. The law enforcement liaisons are doing this pretty much daily as well. They help to advocate for clients with the law enforcement officers, and they help us to ensure the safety of everyone when we're on the scene of a situation. And again, we address what are the community needs at that time, and try to make the best plan possible so that we can not, again, have to hospitalize or take someone to jail. I really want to emphasize that. That's really a lot of the goal of the work we do. So next slide. So in terms of when is MCRT available? Well, the hours of operation are 8 a.m. to 8 p.m. However, we are really a 24/7 program. So we have kind of reduced hours after the 8 o'clock, 8 p.m. time frame. However, we do have people who are on call. There's always a manager and a staff person or two who are always on call to help assist with any phone calls that may come in after 8 p.m. all the way to 8 a.m. And so we may get phone calls at 2 in the morning, 4 in the morning. We address that because we want to be able to be available to people when they need us to be available. And to access the services, there's a 1-800 number that is our call center phone number. And that's how the people access services in our system of care. And they would call that number, they would select option 2, and there's a dedicated law enforcement line that will be able to connect us with law enforcement providers. We also have a community line that will allow for folks who in the community want to call on the behalf of maybe a friend, a relative, someone they are observing in the community who may need some help. Next slide. And so where's MCRT? As I said, we're pretty much everywhere in Santa Clara County. We do stretch the entire county. We used to be kind of, our main location was, this is pre-COVID, at Valley Medical Center on the VMC campus. However, now since, we have had COVID and we're still kind of struggling through what's going on currently. So the staff work from home, and actually that's proven to be really helpful because they're in the community themselves, and they can have quicker response times to situations where the needs may be throughout the county. And one of the things that's really nice is we have a couple of staff. Again, these are new things that are happening, so the slide just needs to be updated because it's new as of today. We have a satellite office in the Gilroy office area, and the office hours are now 10 to 8, not 10 to 7, because we have a second person there who's Spanish speaking, and that's really been a real plus. She literally started kind of soloing and going out there with her team and taking on calls. So it's really nice to see that. So that's pretty much where we cover the entire county. So next slide. And like I said, accessing the mobile crisis response team is through our call center number. Again, that is a 24/7 number. And you would just press the options as noted on the slide. We also have available languages. We have staff who speak, in addition to the English, Spanish, and Vietnamese, but we have access to a language line that's available to us that has multiple languages. And so it's a real help and a real lifeline when there's a language that we really need to utilize and to be able to communicate with family or the individual, whoever that may be. So we do take advantage of that resource. Next slide. And in terms of sort of recent updates, you'll see in the next slide a table, but in the month of December, there was a huge increase in services that were provided compared to the previous year, 2019. Like I said, with COVID, things changed for us as well in terms of the amount of services and such. But what we did was we ended up screening quite a few folks. As you can see, 3,200 people in the year 2020. There was a huge increase or sharp increase because of the COVID and what was going on. There was also a lot of things happening in our community, locally, statewide, and nationally with regard to police use of force. So I think we saw an impact here in our community as well. Law enforcement officers are our most frequent callers to the line, so that we respond with them pretty frequently. The clinicians have averaged over 200 plus field visits a piece last year. And San Jose PD is probably, because of the proximity and size of the city they serve, they're probably our biggest law enforcement agency that we respond to, because they have, it's just the size of the city that we, that San Jose is. So we have dedicated officers. Here it says 5 days a week. It's actually changed to 7 days a week. The city of San Jose has a team called the MCAT team, Mobile Crisis Assistance Team. And they have 2 teams that operate with a sergeant each and 4 officers. And they spread that work out through the 7 days and work with us every day as well. So we're really happy to have them to be available to us to provide that dedicated support to the team when we go out into the field and work together. So that's a good thing for us. Next slide. And here is the slide I was referring to in terms of field visits by month. And as you'll see, we start out in the blue with the total number of field visits in 2018 when the program started. And you see it's, little ups and downs there. And then it began to come alive in 2019. And then we really start to see huge spikes when we get to 2020 as terms of the calls and frequency of field visits by month. It's been quite remarkable. The numbers have really increased. And that's the reason why we have additional staffing, because we can't meet the needs without the staff. And we want to be able to do that because we want to serve the community as best as we can when the calls come in and when the need arises. So, and I believe that's my last slide, Jan.
Yes.
So I'll give it to you. All right. Thank you.
Thanks, Sandra. And I'll go
Sure.
over the CMR and then we'll take questions after my section is completed. Hold on a sec. Okay, so with the county's new community mobile response program, as you see in the middle here, you can see the behavioral health crisis mobile continuum of care. And Sandra spoke about MCRT, but we also have PERT. But this new program here at the very middle, at the lower level, is really utilizing a community-based approach. In 2020, as all of us here in this virtual space, a lot of things happened with COVID-19. A lot of race equity and social justice issues came up. Also with George Floyd's killing, where our community members really called for a community mobile response program that did not include or involve law enforcement. And why is that? We know that with communities who have experienced historical trauma, they may be deterred from seeking help. And so this is really the aim of this new project. Currently, it's in the implementation process, but slated for implementation in 2022. So I think one of the things we can do here is share this PowerPoint slide with Melvin. And you can see with this slide a really high-level overview of what each of the mobile response program that we currently have in place in our county. So with our CMR for short, this project is funded through the Mental Health Services Act. So I just wanted to highlight that through the innovation component. And within that component, there are specific regulations and requirements. So there's 4 distinct requirements. The first one states that the county shall design and implement an innovative approach or project to do one of the following things. So you can see here that what we're trying to do is introduce something new in our county that has never been done before. Also, it has to be innovative. So item B, it cannot be something that is already in place. And so again, around innovation. The third and the fourth item here is the primary purpose. So the purpose of the project is really to increase access to mental health services, increase quality of mental health services, as well as outcomes. Also promoting interagency and community collaboration, which I'll address in the future slides, and also increase access to mental health services. And overall, the primary aim is to focus on mental health and mental illness. With the CMR, there are 5 innovative approaches that were developed that came out of stakeholder meetings. The first one is that family involvement was a key component. So encouraging family in all aspects of the process, again, based on the client's preference, from the phone screening to riding along for a hospital admission if needed. The second one is having it be prevention focused, so focusing on lower acuity situations and diversion, as well as providing pre and post assistance. The third one is access through a trusted community phone line, not associated with 911. The fourth one is creating a trauma-informed mobile response vehicle that would be going out to the community, designed with community input. And then lastly, having community collaborators in place. So having a mechanism in which we hear back from the community of what's working and what's not working and what can we do better. So here is a slide that provides a high-level overview of our planning process. It started last year in July. We conducted several planning meetings from December to January of this year, and really asking various community members and stakeholders feedback on the following items that you see here on the very left, such as the service location of the CMR, the composition of the various teams, such as the call center, as well as the CMR on-site field team. What should the transport vehicle look like? So all that came out, and then we at the second column, you see here, we synthesized that information with our stakeholder group, and then eventually posted that information and design of the program for the required 30-day public posting. And here you can see some of the general common themes that we heard through public comment. Some of them resulted in an update to the plan, such as updating the salaries of some of the staffing. But eventually we received Board of Supervisor approval in April. We presented the information to the state Mental Health Services Oversight Accountability Commission, and they approved our program and budget plan. So here is a comprehensive look of who participated in our planning process. And one of the things we really wanted to do is to get feedback from many of the people that that needs representation in terms of this new project. So you can see here, we had various ethnic groups, African ancestry, Chinese, Filipino, Spanish speaking, the Vietnamese community, as well as really learning and hearing from our clients and consumers, family members who have lost loved ones with police involvement and justice involved individuals. We held various sessions. We collaborated with various community-based organizations, but this is a comprehensive view of who participated in the process. So one of the things that was key as part of the stakeholder process was how are we defining crisis? So the first paragraph that you see here really defines how we intend to help the individuals out when they're in crisis. So the new CMR program intends to proactively help individuals in crisis and a behavioral health related situation where an individual needs assistance in resolving conflicts or stressful situation. The program team will help individuals experiencing an increased level of stress and anxiety by conducting assessments for medical or behavioral health needs to minimize and prevent further escalating the crisis and provide the individual the support that they need during this time. And also one of the key things and takeaways that many of our stakeholders who participated in the process was to formalize why this new program came about in the first place. So this is really highlighting how George Floyd's killing really impacted our community, and really wanted to make sure that the program we're developing is really about ensuring that we create a new program through a race, equity, and social justice lens. So for the CMR, there are 3 locations for this pilot project. And one of the goals is with this innovation project is to determine whether or not it will be successful. And if successful, can we go ahead and also create new service sites in the future? So one of the things I highlighted in the beginning in December and January, kind of talking about where should the pilot sites exist? And many of our stakeholders commented, well, San Jose, there's a major need there, as well as Gilroy. During the 30-day public process, one of the comments from several folks, the common theme was, how about North County, the need to support that, your area as well, with Palo Alto and Sunnyvale. So the third site was, as a result of the public comment we received during the 30-day public comment, and we update the plan based on that. So here's just the next 3 slides is around the CDC's Social Vulnerability Index from 2018. On the lower left-hand side, you'll see the highest to the lowest vulnerability. And really the focus here is to really focus on those, you know, on the lower left side, the highest to moderate, you know, greater than moderate vulnerability in the selection of the sites. You can see there Gilroy, San Jose, and North County. And you can certainly visit the source of our of this data set. Within San Jose, there was a need to focus even further, and specific codes were called out. For the North County service area, there were, again, the graphing and the coloring of the highest vulnerability index, and really looking at the different areas here around Sunnyvale, Santa Clara, you know, Palo Alto, and Mountain View. The Community Mobile Response Program is comprised of 2 unique teams. So there is the on-site field team that you see on the very top. We're going to have community collaborators in place for each service site. So there's going to be one for North County, one for Gilroy, and one for San Jose. Each on-site field team will always have an EMT, a crisis intervention worker, and a peer outreach specialist with lived experience. And one of the things that you see on the lower left side is that our stakeholders really wanted this program to prioritize recruiting individuals with lived experience, and also having the capacity to have volunteers in place as well. And this, again, will be a 24/7 operation. And the second component of this project is having a call center team. So the call center team will be comprised of a program manager that is licensed or license waivered, and having peer specialists, peer family, and paraprofessionals. Again, here highlighting the 3 service locations in the middle, highlighting how we're really supporting our individuals, clients who have lived experience, who would be interested in becoming a peer outreach specialist, and that it is a paid position. They're there to really provide peer service support, reflect the community that they serve, and have lived experience. And then on the right-hand side, which was something that we really asked input on, which was adapted from the CAHOOTS model from Eugene, Oregon. So you can see that when a crisis call comes in, the CMR call center picks it up, assesses whether or not there's a service need, either to dispatch a service field team, or can the call center team de-escalate the situation over the phone. So with the CAHOOTS model, it goes straight to the dispatch field team. But with this one of the main key comments and feedback that we got from stakeholders was that if I'm in a situation where I need help right away, I would like to have the person I'm talking with on the other line, if they can help me and it gets de-escalated at that point in time, all the better for everyone. So again, either it could be de-escalated through the call center team, or then if there's a need to dispatch, bring out the on-site field team to North County, Gilroy, or San Jose. And then you can see the protocol here, if the field team decides if additional help is needed, and being able to do those options. But what's very important, whether you go through the field team or the call center, that there's always a follow-up within 24 to 72 hours to ensure that we link up everyone that calls to services that they need. So a key part of the Mental Health Services Act, especially the innovation component, is the evaluation. Again, we're trying to learn something new. So we're putting something new in place in Santa Clara County and really assessing whether or not we have new people calling in to seek services. So previously, a lot of the folks, family members who lost loved ones commented like, I would be afraid to call 911 for fear of law enforcement involvement. So the hypothesis is with this new program, with no association with 911, would people be more encouraged to call and seek out help? I'm going to highlight a few initial outcomes we're looking at: increased community trust in calling for help during a crisis, building the foundation for a community-based system of care that meets people where they are at, and minimizing the number of law enforcement involvement in behavioral health calls. The ultimate outcome, you see a variety listed here, but one is, again, decreasing the number of deaths due to law enforcement involvement in behavioral health situation, and really decreasing the impact of historical discrimination on communities of color. So where are we at now with the CMR? So since the Board of Supervisor approval in April and the state approval in June, the County of Santa Clara released and commenced the procurement process for the CMR for both the call center and the on-site field teams for all 3 service sites. In the meantime, we are also have been busy trying to work on selecting a permanent name for the CMR. So we've convened a couple of meetings in June and had feedback on potential names. We conducted a survey for over a month, and I thank Melvin to helping distribute that out to your area as well. On the bottom here, you can see the duration of the survey, how it was translated to various languages, and how we shared that through social media. Overall, we received 263 votes, and the winning name is Trust. So Trusted Response Urgent Support Team. So going forward, instead of me referring to the CMR, I will refer to it as Trust. So I'm going to pause here, and Sandra Hernandez and I can take any questions you may have.
Thank you both for your presentation. I neglected to mention earlier that the PSAB is going to be asking questions, but I will not open public comments until all 3 presentations have been concluded. So let me open it up to PSAB members. Do you have any questions for Ms. Hernandez or Ms. Morel? Joan, please go ahead.
Hello, thank you for the presentation. It was interesting. I missed a few things, but I have a few questions. Number 1, can you go to high schools? Number 2, who are the people who do the work, who are essentially your clinicians? I mean, the people who are going out on calls or fielding them on the phone. And the third one I wasn't sure of, the CMR is something that is coming or exists?
It is coming. So it was recently approved by the Board of Supervisors this year. We obtained state approval of it in May, and we're in the process of implementation with rollout aiming for early 2022, if that answers your question.
It does, thank you.
And then I'm going to defer to my colleague Sandra for the.
Sure. So with regards to your questions, there are the folks who are responding to the calls or going out in the field are all behavioral health licensed clinicians or licensed waiver working towards their licensure, but they're all master's level, and they're all skilled clinicians in crisis work or crisis assessment work.
Thank you.
Yeah, okay.
And the other question was, can you go to high schools?
Well, you know, our program serves ages 18 and over. What I have said to people is we don't generally go to a high school. There is another program that would likely be the people to call. It's called Uplift, and they would probably see more of the high school age youth that would need maybe some support if they're in crisis. What I do say is that in the community, on occasion, it's not very often, if there is a need, we will assess somebody who might be 17 years old. We generally do not, because it's a referral that we would make to Uplift, but you know, our clinicians are able to do that if need be. We would never walk away from a situation because they didn't meet an age criteria. If somebody's needing help, they need help. We're not going to stop and say, sorry, we're going to address it.
Thank you very much.
Sure, you're welcome.
Member Sandhu, please go ahead.
Thank you, Chair. Thank you, ladies. That was a fantastic presentation. I would love to see a copy of the slides so I can read more about it. Actually, my only question is one of the best resources what we have around here is the Community Health Awareness Council. I suppose you do know who they are, CHEC, which is based in Mountain View and has extends to Los Altos and Los Altos, I wish it was in most areas. And to answer Joan's one part, whether they can be in high schools, CHEC is in high schools. Do you guys coordinate and pick their brain too, because they've been around for so long, 40, 50 years? Do you guys do that? Because their training sessions for their interns is amazing. And there's a line of people who want to join that internship. So I just wanted to ask you that. Thank you.
Right now, we have not reached out to work with CHAC. Children, you're talking about Children's Health Council? Yeah. We have
community health. Community health awareness, what do you call it, council, yes.
Yeah, okay. Yeah, no, we have not worked specifically with them, but we're certainly always interested in listening and partnering with people that, we, would have that ability to work with. But because they do serve more of the younger crowd, the younger age range, we probably would not, because we're working again with adults primarily. But that's not, don't want to say we would never do that, but generally most of the folks we tend to see are adult 25 and older, but not necessarily. We are looking at wanting to do more coordinated integration work with some of our younger youth, because we do recognize because somebody turns 18 doesn't necessarily mean they're equipped and ready to take on the adult world. There's some folks who struggle, and we want to make sure that we're as prepared to work with that population as possible too. We recognize it's a unique, what we call a transitional age youth population. People are transitioning from sort of this teen sort of to young adult life, and we want to be able to support them with their unique challenges that they face as well.
Thank you. Member Sandhu, does that answer your question?
Yes, it does. I did wish that from county level, they did take care of the youth too, because especially with COVID, the numbers, if you read the numbers of teen suicides have gone up tremendously, and there is a mental crisis there. So that's something I guess we'll have to bring into the legislators and say, hey, please pump in some more money and create a certain thing for the youth too. Thank you very much indeed.
Oh, and I do want to add, we don't have our colleague here, but we do have a youth mobile crisis program provided by Uplift Services. So if there's interest from this group to learn more about their service, we can certainly go back and request.
We have a contract with them to help provide that service for their youth.
Thank you. Member Wang, please go ahead.
Thank you both for your presentations. I have a few questions, so I'm just going to ask them one at a time. First of all, for the mobile crisis response team, when they're working with law enforcement officers, do the licensed clinicians or whoever's on the mobile crisis response team, do they place the 5150 hold, or do the law enforcement officers?
It's the clinicians. The clinicians, it's like what clinicians do what they do best, so to speak, and law enforcement, we hope, does what they do best as well. But it is also a collaboration, because we do want to work collaboratively with our partners, but it is primarily the clinicians who are doing the assessments, because that is their specialized training, and we really want to make sure that we're addressing, again, the behavioral health aspects that may be unique to what we're trained and understand and know, versus law enforcement who may not have that same level of training. Oftentimes they don't. That's what makes it different, because we're going in with our perspective and they're providing their perspective, and we do try to listen and partner with each other. We may miss something that maybe they picked up on, but primarily this is why we also travel in pairs. There's two clinicians that go, so that they can also have some opportunity to consult with one another and make sure they're making the best decision for that individual. at that moment in time.
That's awesome. Does that also mean that the mobile crisis response team transports the people to Valley Medical Center or wherever they go?
If they need transportation, because we've made the decision that they meet the criteria for what we call the 5150, there's a couple options. One is the county has a contract with a ambulance company called WestMed, and oftentimes that's the transportation of choice. Sometimes, though, there is a long wait for that ambulance to show up. It could be, a period of time, and maybe things are moving slow, and maybe the individual's getting anxious and maybe more upset because the wait is becoming too much for them. So sometimes an officer will assist in transporting if need be. It sort of just depends on the situation and what's going on with that individual at that moment in time. But we try to do, the least invasive kind of thing possible. We try to make it as comfortable if that's possible as well, and really support them through that process and explain exactly what's happening and why it's happening, and inform them about the process and procedure so they understand they're not being arrested. This is, we're trying to get you some help, and this is one way, to try to do that.
Cool. I'm going to ask another one, and then you guys could circle back to me because I know other people have questions too. But for the people on the mobile crisis response team who are licensed clinicians, what do they specialize in? Like when you're hiring, what do you ask for, I guess?
Well, I did the interviews today, and we really want to look at people who have good intuition, who have good critical thinking skills, who have the ability to de-escalate, have empathy and understanding for a person's situation, their cultural background, their family background, what's unique about them, so that we can understand what's, where their perspective is, where they're coming from. We don't want to suggest we know who they are. They know themselves best, and we want to understand who they are. What do they need from us, and what do they need maybe from their family, or that we could ask of their family. We try to ask people to really think about what it's like to be in a sort of on the other side of the fence, as I say. If it were you or it was your family member, how would you want to be treated? Understanding that when somebody is in crisis, we're not always seeing them at their best. And so it's a challenge at that point. And how do we do that in a way that is respectful, that's meaningful? So we're looking for people who have these kind of qualities. We want them to also be clinically trained so that they understand what they're doing and they understand the legalities of what they're doing. A 5150 is a legal step that somebody's taking. You're basically detaining somebody. And so we don't take that lightly, and we don't ever presume that it should be taken lightly. It's something that's a very serious thing, and we want to make sure we do it correctly.
And in terms of like professional specialization, do you ask for anything, or?
Well, they're all master's level. So we're generally hiring folks who are either on their way to get their licensed clinical social worker license or marriage and family therapy license. So these are the backgrounds. Some people have psychology backgrounds and getting their marriage and family therapy license as well. And those that are, we do provide supervision for them. So they're in training basically and getting weekly supervision. So, we can meet the hours that are needed for supervision before they can take their test. And then they become licensed, which is a good thing.
Yes, thank you.
Sure.
Thank you. Vice Chair Frink, please go ahead.
I just wanted to be clear about how you guys are staffed. So you guys are going to have 17 people, and your territory, your jurisdiction is essentially all of Santa Clara County, which is 1.9 million people. Is that correct?
Yep. Yes, fair.
So you mentioned that the way that most people interact with you is because a police officer calls for your services, and you are reachable through the 911 system. Is that correct?
That could be another avenue. We also have another program that does respond specifically to 911 calls, and that's our PERT program, but we weren't speaking about that today, but we do have a different program that does respond to 911, but the MCRT team will as well. They will respond to 911 calls.
But what I'm asking
through law enforcement.
But what I'm asking is so I think the general idea for most people is to take law enforcement out of it, right? Like we want to try to, at least me personally, I want to try to leave law enforcement to do like crime stuff. So if we were doing and I needed your services, could I call 911 and get a hold of you?
Yeah, that is a possibility. Absolutely. Yes, because the dispatchers in many of the communities know who we are now. And so we try to teach people when we have presentations is, to call and ask for a CIT officer, somebody who's trained in crisis intervention training, because they tend to have, because of their training, they have a different approach than other officers because they've been trained in how to work with behavioral health individuals who are in crisis, who need some support and de-escalation. So we also, let people know that, ask for, MCRT if need be, or ask for this so that people know they're not just sending an officer who may not be aware of the situation or what they might be able to do. And once they get out there, they may say, oh, we need an MCRT team. We realize this is really a mental health or behavioral health call, and we're not as equipped. We need someone to help support us because we're not really sure, what's the next best thing to do.
Are the dispatchers able to, why aren't the dispatchers able to say, this seems like a project for an MCRT team rather than an officer? I mean, is that mean that we should be working towards that? Is that?
Yeah, it's a very good question. It's something that I am actually researching because I do think that is another way to consider it is having call takers, basically, who would be able to assess at that moment. Does it go to a maybe the trust CMR team? Is this a call more appropriate for a PERT team? Is this more appropriate call for an MCRT, or is it just a plain law enforcement need? But yes, I would like to be able to have that ability. And I know there are some programs in other states that do that and do it rather well. One is in Houston that I've been following, and they have a very nice system set up where call takers are trained in how to manage those kinds of calls and decide where they go and based on questions that are being asked. And it's not like a long list of things. I mean, pretty quickly, like, okay, this person needs this level of care or support. And so we're going to respond. So yes, it's a great question. It's something that I would like to pursue myself because I think it would be really helpful to have.
And my final question,
sure.
If in a perfect world, you could have whatever you wanted, how large would your staff be to serve 1.9?
Perfect world? Oh my gosh. I think we'd need to double the size of the team. At least, I mean, if we're really going to be a true 24/7 program where we have. However, that said, we do have data and statistics on when are most of the calls coming in. And I have to say the 12 a.m. to 8 a.m., it is really pretty, it's not quite as busy. I'm not saying there are things that aren't happening, but they tends to be a quieter time frame. So generally, most of our calls come in between the hours of 10 and 9 p.m. Most often it's that range.
Thank you so much.
Yeah, sure.
Thank you. Member Tang, please go ahead.
Yeah, thank you to board member Frank, by the way, because I had the exact same questions about 911 calls being routed to MCRT. So I have a couple questions. Is there data on the number of times the accompanying officer for the clinician has found it necessary to step into that situation?
I would have to go back and look, but I don't think we have that kind of data because most often it's the clinicians who are making the calls. Primarily it is. It's really not law enforcement so much. I mean, they may interject, they may make a comment and offer perspective, but it's really the clinicians who are making that decision to whether they're going to write a 5150 hold or say, I think this person, we can probably just get some resources and let's check with them tomorrow. Maybe let's do a follow-up. Let's find out how things are going with them. We had a situation recently where that was very successful, where somebody was quite upset. And I said, well, let's not push them into a corner. Let's back off for a little bit, give them some room. And that worked. And then the person was receptive to saying, okay, you can call me back in about an hour, or you can call me back tomorrow morning. I think that's okay. I'm not going to do anything. I just was upset. I was just angry and I needed to just let it out. And so we respect that. We all react to crises in such different ways that some of us get quiet, some of us get loud, and some of us cry. I mean, there's all kinds of ways to manage various kinds of crises. And so you have to kind of get a sense of, what's in front of you at that moment and figure out what's the best solution at that particular moment in time. And sometimes you have to come up with things that are not sort of typical, like, okay, let's give them some breathing room. Let's not push them into a corner. That's just we already know it's making it worse. So why would we do that? Let's just back away. Let's give them some breathing space. And it worked. And it was really, I think everybody was happier because it was escalating. And it was like, well, what you're doing is making it worse. Let's not do that. Let's give it some time, and let's see if time will help to change that situation. And it did. And as far as I know, everything worked out pretty well. And the person was just upset and they just needed to vocalize it. And I think it just scared people because he was loud.
Thank you. My second question is, I love that this program is like the mobile response is expanding. And I love that like there are different levels of care. And I guess I'm a little unclear, like in what situation, like would I call the new like trust program over MCRT and PERT? I know like PERT is probably like the most escalated situation, and the MCRT is probably a little below that, but I guess how, in what situation would I call trust over like a regular provider?
You want to take that call, Jan, or that question?
Yeah, I think that's a really great question. The one thing around trust is focusing on lower acuity situation, more prevention based, where there are no safety concerns. So as Sandra had mentioned, that with the MCRT or even PERT, which is more a higher level of care, usually there needs to be a determination whether or not it's a situation where it is more of a lower acuity, but within the workflow. And that's one of the things that we are requesting all our proposers who are submitting a bid for the call center on-site field team is to be able to develop and further grow the workflow that I shared with you. So being able to create, when would it be appropriate to route this call to, let's say, the MCRT or PERT, or perhaps the call was really started out okay, and they just needed somebody to be there on site. They come out and the situation was not at all what was expected to be able to do an assessment and be able to have a triage or workflow to be able to take care and help out the person in need as appropriate. And sometimes there may be a cause for where it could be where somebody just needs resources. So being able to provide that information. So being able to assess that level of need. So it's going to be the lower acuity, and then more medium, higher would be resolved hopefully through the MCRT. And then really with, if there's a danger to self, potentially the PERT team through a 911 dispatch call.
So like, I guess potentially like maybe somebody's like having an episode, like having kind of like out of reality, or like, I don't know, just experiencing like pretty bad symptoms, but not so much like in a way where they're like a danger to themselves or like somebody else. Okay, thanks.
Yeah, I mean, that would be, anyone who calls the CMR will not be turned away. So there will still be an assessment that's done. And if an on-site field team visit needs to be conducted, it will be done as appropriate. And then you have an EMT, you have a crisis intervention worker that's part of the team, and a peer support specialist. So there's the 3-member team to be able to determine whether or not, hey, can we help this person now? And again, it may take some time. You may be with the client for some time, like what Sandra was saying with the individual that was helped out recently with the MCRT team. Sometimes it may take longer to resolve, but it's not to say it cannot be resolved with the CMR or trust team. So again, there's different ways to seek services, and the aim of the trust program is to encourage folks to call in, and then it could be the gateway to provide them service, whether it's through some information or linkage, or to really providing them help to more intense level of services.
All right, thank you both so much.
Thank you. Member Langton, please go ahead.
How long would you say you guys have been available to the public, like at the capacity that I'd say you are now? Like, has the MCRT been a part of Santa Clara for 20 years? Like, yeah, how long,
Sure.
like, how have you evolved from like a...
We've been in existence about 2018.
Okay, so it is a fairly new...
Correct. Yeah,
So,
we're fairly new, and our PERT program is fairly new. We launched in March of this year. So that's also a newer, and it's also an MHSA funded program as well. So these programs are new. They're new to our community, but I think we're seeing the beginnings of some success. And I really have a lot of high hopes, and I really believe that CMR is going to be equally there, because we know the need is there. We've heard from the community, and I think, you know, I'm really excited about that program coming on as well.
So yeah, I've had, you know, some personal experience more back in like 2015 trying to seek like mental health services. And yeah, it was really kind of a gauntlet. There was no real, like county entity that you could go to for that would then have maybe a list of all the different mental health facilities in the area. Do you guys work with Momentum?
Momentum is one of our contract agencies. So yes, we do work with Momentum, you know, when service collaboration's needed. Absolutely.
Because like for me, I think having like a point person, like entity like yourself is great, but the resources kind of like outside that you're referring people to are really where the kind of the work is done. And yeah, I'm just wondering, like I found the Momentum model to be kind of you know, really well run. It's a very warm environment kind of. And yeah, I'm just curious, do you guys try to foster new kind of like mental health entities being formed to fill in the gaps in other communities that aren't like Palo Alto or whatever that have, you know, a facility like that?
Sure. Yes. There are many community agencies actually that the county does contract with. And certainly open to other entities that may be in the community that, you know, we're not aware of, but we do, I think, try to reach the community through whatever means possible. And there are some agencies that have specialized skills that might be able to address populations that the county is not able to. It really depends on what the needs are of the individuals, and the community needs are as well. So yes.
Okay, and do you have any resources for people without health insurance?
Actually, we do. We do have folks, again, it's calling our 1-800 number that I had put up there. Yeah, you can start with that phone number. That is the entryway to our system of care, and anybody can call that number and, you know, share what your concerns or needs are, and that's how things get addressed. And yes, we do see people who don't have insurance.
And
we help them to get it if need be. If that's
they could get potentially funneled into care even though they're you know, lacking resources. Okay.
Correct.
Right, thanks.
Sure.
Thank you. Captain Canfield, please go ahead.
Thank you very much. I just was looking, Sandra, maybe for some clarification on the mechanism through which people call for MCRT or some of your other services through 911 dispatchers. I'm not familiar, at least in North County, with that being the case. I'm not sure if that's maybe through the San Jose project that you guys have together, or maybe something else I'm not familiar with, but I was hoping you could fill me in a little bit on that.
Sure. Well, because San Jose, is our largest area that we serve, we're kept quite busy by San Jose. So it's generally the San Jose dispatch and county communications. Again, we do some work with the sheriff's department, but we also have a PERT team that is connected well with the sheriff's department. So they go through county communications. So we do some partnering there. But yes, I mean, I understand. Actually, I don't know if it's possible, but we do have one of our law enforcement liaisons on here. I don't know if he can be able to enter the conversation, Tony Lopez, but he's one of the folks who's helps to put the word out and work with all these agencies, communications and such, so that we can make sure people have access, because we don't want to confuse people about who to call and where to start and all that. And I think we do realize that having now 3 programs, soon to have the 3rd program with the trust program coming on board, that we want to make it seamless for people. We don't want to make it too confusing where people then say, I've called the wrong number, I don't know, I'm not sure who I should be asking for. So I think we need to address that. And I think that's part of our plan, is to do that as we continue to build this next new program, the CMR trust program, because we want to make it so it's not complicated. We want people to feel like they can make a phone call and not have to worry that I called the wrong place, or that they're going to get passed over and transferred to somebody else and don't really get their service needs met. Did I answer your question? I'm sorry if I didn't.
I think so. So currently San Jose and through County Comm through the Sheriff's Office, but not actively dispatching through us, but we're open to further conversations.
Sure. Well, we will have a clinician in Palo Alto starting, and I understand that Palo Alto, Mountain View, and Los Altos share a communication system. Is that correct?
That is correct. Yes.
Yeah, right. So they will be, that person, though, unfortunately, is really dedicated to the Palo Alto area, but yeah, maybe that will be a starting point for further communication discussion. Don't know.
Thank you. Member Wang, you have your hand raised again.
Yes, thank you. So I'm kind of wondering, kind of going off, I guess, what Captain Canfield was saying. So if I call the 1-800 number, would I be able, I guess, like, would the people who pick up the phone triage me to the MCRT or the CRM or any of the programs, so all of them connect to the same number?
Not right now. They will triage you if you call that number. That is correct. But no, we're not quite set up that way. And I think, as my colleague mentioned, the community really is looking for an alternate way to for people to access their services. And they're looking for a way other than a 911 communications system. So I think that we're trying to look at ways how we can make this work so that, again, people don't have to struggle with who do I call and where do I start. But right now, if somebody were to call the 1-800 number that I listed, it is triaged, and then we take it from there. And that is a clinician who is triaging the call.
And would it be possible for the number to be shorter, or is that just like something to consider for the future?
I think that's a great question, and I think that is something that I believe my colleague here, that's what the point of the trust program is, to have a short little number, to not have to memorize a whole long one. Yeah, unfortunately, right now, that phone number is the main number to our system of care. So that's why we're using it for now. But great feedback, because we do hear that often, that, we need an easier number to reach. So I appreciate that.
Thank you. And another question, would law enforcement officers be able to call the trust model like the MCRT and vice versa? Like would the CMR be able to call law enforcement officers, or are they like very distinctly separate?
Anyone can access trust. So it's really there to enable anyone, whether it's a family member or a friend, you can call on behalf of them if needed or for themselves. But it's really to help everyone gain access to services. And in regard to the phone number, I'm not sure if you are aware or if this group is aware that currently being heard in Sacramento is Senate Bill 988. So 988 would be the phone number that is being considered as a crisis, suicide crisis line. But I would encourage you to explore that as well.
I have a final question. Hold on. Oh, right. So I guess I'm just wondering some of the ways that you guys are spreading the message about the MCRT and the trust programs. And I've heard about it because I'm in this meeting, but I'm wondering for other people in the community how people will be able to access.
Well, I think for MCRT, it's been through our collaboration and work with law enforcement and our law enforcement liaisons in particular. They don't just all work with law enforcement. They're actually provide presentations sometimes to community agencies, community groups where that interest is there. Maybe they serve a vulnerable population. So maybe it's Second Harvest Food Bank. Or some other kind of agency is saying, or Parks and Rec, they encounter, I mean, think of places where people congregate, people go. I mean, people are all over the place. We're all doing something. We're a mobile society. So, these are places where, they're also putting the word out. I think also it's word of mouth. This week, I had a conversation with a district attorney. I mean, I think it's from various places where the interest to know more about these kinds of programs is starting to I think, grow. And so, wherever the request is, we'll go, we'll make a presentation. I'm doing another presentation tomorrow to our internally. Not only do, it's the community, but internally in-house, our own staff sometimes aren't clear about, well, so what do you do? So we're doing a presentation tomorrow. I'm doing one tomorrow, Friday afternoon, to our jail staff, our custody health staff, because they've heard about it, but they don't know a lot about it. And yet they're working inside the jail. They're not outside in the community, but some of these folks that we've had contacts with that are really in need of that level of care at that moment in time, they are working with them as well. And it helps to understand who these, what's been going on, this individual's history, why are they in jail at this moment in time, what's happened, how can we work to move them so they're not coming back to the jail, what can we do, what are the resources available to somebody other than jail. So we're doing presentations in-house as well to our own colleagues who are asking those questions. I've heard of your program, but I don't know what you do. So we try to put the word out wherever we can.
That's awesome. And one final question. Earlier you mentioned San Jose's mobile crisis assistance team. Is that part of the San Jose Police Department or is that part of the city?
Yeah, it's part of the San Jose Police Department.
Okay. And I'd love to read more about it if you have any information or piece of information that you think is cool.
Sure. Okay. Yeah. Please.
And I do want to add one thing around strategies about trust, the new program. So our stakeholder group and community members really provided a lot of input and a lot of great ideas came about from it. So we had a planning session specifically for ages 18 to 25. So it's that transitional age youth that Sandra was talking about. And one of the ideas that came about was leveraging social media, perhaps taking a video of the mobile transport and how that's going to look like, doing a visual, tour of the vehicle with the staff, and then also having our on-site field team do visits out there in the community and really being seen by community members. And also with the selection of the permanent name of Trust, we are conducting a countywide logo contest that will be starting up soon. So that's also another way to help engage our Santa Clara County residents to be part of this. And so the selected logo will be part of the wrapping of the vehicle, and there's a cash prize of $5,000. So I can certainly share that when that is available, but there's a lot of exciting ways to communicate this program. And then with the community collaborators in place, they're going to be embedded in the community. They're really there to convene also a committee of system partners, community-based providers, individuals embedded in North County, Gilroy, and San Jose to really provide input and be also the sharer of the information about trust. So I think there's a lot of opportunities to really engage, and I'm very excited about it for next year. So.
And just real quickly, we do also have social media campaigns too. We have some videos of the PERT team and our mobile crisis response team on YouTube.
Okay, thank you. I just, I really appreciate all the questions that everyone has. I'm learning a lot. I am conscious that we still have another presentation in this section, and then we have a full agenda after. So Vice Chair Frink, I see you. Member Brodowski, I see you. I'm going to take the opportunity to ask a question myself, and both of you think about being the last two, I think, and then we really, I think, should move on to Captain Yeager. All right. My quick question is actually for Mr. Gaines. I'm curious. These are county programs we're talking about. And Captain Canfield, you may have some thoughts on this as well. What are the, what's the city's role in bringing these programs to Mountain View? Because they're county programs, so I'm just trying to reconcile that.
Good question, thank you. So I guess I have to kind of rewind and talk about last summer when we started the ad hoc council subcommittee on race, equity, and inclusion. And the council was listening to the public and learning that the city needed to address alternative responses to mental health crises. We had the MCRT actually came and did a presentation to the REI subcommittee and discussed the MCRT program. And we were able to talk about how the program had been a resource in Mountain View. But we were also acknowledging that mental health crises are things that require various different types of responses. So we were constantly looking for different responses, and we participated, the city of Mountain View participated in a regional collaborative with other cities, Palo Alto, East Palo Alto, Sunnyvale, Los Altos, Redwood City, in partnership with Stanford University, and we explored the Cahoots model. And so we got really, really excited about, the potential to have something like Cahoots in Mountain View, while acknowledging that the city of Mountain View doesn't really have the capacity to do such a thing. I think we had a conversation with the behavioral health contractors of Santa Clara County, and they put forward a proposal that we were very supportive of, but weren't really sure what would happen from that. And in continued communications with our partners, Palo Alto, Los Altos, for example, we learned and followed what's happening in the county, which is very similar to what was proposed by the behavioral health contractors. So we were really just, contacting Jan and other county folks, just seeing like, how can we make sure that this comes to Mountain View? So we, set up meetings with Jan and discussed how it would look for the MCRT to come, the CMR program, now a trust program, to come to Mountain View. And we learned that we could support, them through writing letters to the Board of Supervisors, as well as to the state to make sure that the program received funding. So we wrote letters and just been cheerleaders and intend to, maybe engage you all, maybe as a work plan item as they're doing the implementation of this program, making sure that we're providing them feedback and input. So we see the county as a partner, and we also have a pending funding allocation in partnership with Palo Alto and Los Altos that we may be able to do to enhance programs or bring similar programs or in Mountain View. So we're a cheerleader and an advocate and kind of active while acknowledging that this is a county program that they kind of run the show and we have the ability to support it and to influence it.
Thank you, Mr. Gaines. Okay, Member Brodowski, bring us home, and then we will move on to the next presentation.
Thank you very much. I don't have a question. I have a worry, and it has to do with having a special number because you want to avoid going to 911 because people think the cops will be involved. I think you have to include 911 in this because most of us can remember that number and we can't remember a 7-digit number for a mental health crisis when we have one. I mean, that's asking an awful lot. And if you are making presentations 365 days a year, and each time it's to 10 people, I mean, this would be a lot of presentations. You're going to get to 0.2% of the totals in the county. So I don't think you're going to get out to a lot. Somehow you've got to be able to get all of the 911s on board with you too. And it's not that I think you shouldn't have your own number. I think you've got to have 911s connecting to you. So that's my soapbox, and I'll stand on it.
So thank you for your comment. And that was something that we had actually shared as an option for stakeholders to get to consider. And the feedback that we got from meeting to meeting was a strong feeling that a lot of people really commented strongly how they did not want to leverage 911. We had initially thought about that as the county behavioral health services department. Why not leverage an existing system? It's a number that people already know, but then being cognizant of the Mental Health Services Act and the innovation and really having the development of the program be developed with community feedback, we needed to take into consideration what the public, the participants of the process, put in. So I do acknowledge that that one idea, it was not supported with our stakeholders.
They're wrong.
And that's with the innovation component, you're testing this theory that with this new number, will it increase people to access? So we'll see how it goes. It's a 4.5-year term project. And we have that evaluation and we'll see what the results will show.
Okay.
Okay, thank you everyone for your comments and questions. Captain Yeager, we are heading to your presentation. If you're ready, please go ahead.
Okay, technical difficulties. Can everybody hear me okay? And we can see the screen okay?
Yep.
Yeah, okay. Before I actually jump in, I just want to say something real quick. It's actually very encouraging to hear all of the change in innovation and having been working in this space from the police perspective for quite some time. We'll get there. We're going to get there. We're going to do the right thing. And again, we're very privileged to be able to be in a space that can have a conversation like this and talk about innovation and what we're doing. So thank you for listening to that piece. So good evening, everybody. Thanks for having me. I'm going to talk very specifically about Mountain View Police Department's response to mental health related incidents, and then the development and testing of what we're calling our Behavioral Services Unit, or BSU. I did want to thank Sandra and Jean and Tony, who's on the line as well, for the partnership and collaboration with MCRT as well over the past several years. We may touch on that a little bit, but I'm going to stay very, very focused on the behavioral services unit with Mountain View. So as we talked about quickly, the contacts between uniformed police officers and people suffering from mental health crisis has rightfully so garnered a lot of attention in this country, as we all know, especially when force is used. In general, communities have expressed concern about police officers being the primary point of contact during mental health and crisis-related incidents in general. And those concerns, they range from fear of increased violence by the police towards the individual, an escalation of stress, fear in acting out based on just the police presence or the uniform there, a lack of training for the officers, a lack of empathy and connection with the people during an active incident. And again, the difference is I'm talking about an active incident that's occurring right now. In response to the high profile incidents that we've seen over the past few years, many cities and counties and agencies have reacted by creating various programs like we're talking about tonight with MCRT, MCAT with San Jose PD as an example, all attempting to solve the issue of police response to people suffering from mental health. So how it's done, why, the outcome and goal, and even the success of the programs all vary greatly. We've seen it just in Santa Clara County. What we've seen is there's programs with no or very limited police contact, like the Cahoots model that you guys have talked about and studied, to modified programs that partner law enforcement and EMT, psychological services, or similar kind of combinations of teams that work through incidents together. MVPD staff actually, this was about a year ago now, began conducting research consisting of visits and interviews with a variety of police organizations, sheriff's offices, mental health response agencies locally and throughout the country. And that's how BSU, or the Behavioral Services Unit, the idea for this was actually born. And it's basically through that research, we are changing our operating approach, and that's what we're going to get into today. But this is it's a 6-month pilot program, which we actually officially kicked off in April. So it's still very, very new. One of the common themes that we did discover, though, was that police services are still needed, even in areas with robust mental health programs for their communities. And there's a number of reasons for that, and there's also a number of other themes that we discovered. But police officers are usually the first ones on scene, and or they are seeing an incident happening, unfolding in front of them right there, and they have to do something about it. The role of MCRT and other agencies in collaboration is all a piece of this, but the bottom line is that mental health response in general is a huge, complex issue, and we're gonna talk about this kind of loop thing right here. So many people that are suffering from mental health crises are stuck in a loop, and worse, what we've seen is that how they're entering that system is through the police department's response. So that's kind of the big sort of flashpoint that most people are seeing, the uniform dealing with somebody or a group that's having an issue. An example that I like to use is a call for service, like an officer responds to a person yelling at passing cars and running into traffic. Could be a mental health call, could not, it might, we don't know, right? So that's the call. Officers make contact with the person. They determine that he or she meets the requirements for a 72-hour psych hold or a 5150, as we talked about earlier. They'll take that person, they'll put them on a hold, and then they'll transport them to an organization like Valley Medical Center in San Jose. That's the common kind of county one that we bring people to. They begin to do the paperwork for that. The person's intake is brought into the system there. Then the subject is eventually released. Sometimes it's very quickly, sometimes it's not. And then the loop just keeps happening. The reasons for that release can vary, right? They can vary by the person saying the right things when they're there. They could be lying. They could be completely cooperative. They may not actually fit under further review of a psychiatrist. They may not actually be 5150 and be released quicker than that. There's a whole number of reasons for the release, but a lot of times the person is going to be back out somewhere in society again, and then that loop starts over. It may not be in Mountain View. They may get released in San Jose. And then there's another call, and then San Jose PD responds, and it's this loop. And what we're talking about is lacking a really strong continuity of care for those subjects. Why is that person out there in the first place? and why are they not getting the additional resources that are there? And it's a huge complex issue. This isn't something that can be like a switch that we can flip and just solve. It's a big, big problem. For BSU, the goal is actually very simple. The goal is to intervene in that cycle through follow-up and referrals, with the ultimate goal of reducing the amount of police contact. And this is a police officer saying this, reducing the amount of police contact with people suffering from mental health crises. And the way BSU is set up, that we do that through 4 main changes to our operations. The first one is redeployment or reimagining of our crisis negotiations team. So for those of you that have been in MVPDX and have been around the police department a while, we've talked about our crisis negotiation team. And it's very similar to, it's an actual team of people versus CIT, which is a training that people receive. So CIT, CNT, different things. I'll talk about that a little bit. We're going to go into the crisis intervention training piece in a little bit. But the team itself, the crisis negotiations team, consists of specially trained, sworn, and professional staff who have historically and traditionally responded to critical incidents with our SWAT team. It used to be called the hostage negotiation team, HNT, but we changed that about a decade ago. So it's the team that would respond to a critical incident with our SWAT team. Their job is to initiate and maintain communication with people in crisis. So we're talking about incidents like hostage situations, barricaded subjects, suicidal people, those kind of calls, and then work with that person for a peaceful resolution. The assignment on the CNT team is a collateral one, meaning it's not their full-time position. So there's not enough business in Mountain View for us to have a full-time SWAT team and a full-time crisis negotiation team. So the members of this team are patrol officers, traffic officers, community service officers, asterisk that one, we're going to talk about that in a minute, and detectives. They receive, in addition to all the regular training that our officers do receive, which we'll also talk about, they get 80 hours of basic crisis negotiation training from the FBI. And they have ongoing in-service training 2 to 3 times yearly that consists of everything from technical manipulation of the equipment that you can see in the picture there, to scenarios with our SWAT team, to actually talking down people and de-escalation skills and things like that. Historically, these officers would actually self-deploy to incidents. So if they hear a call, for example, if they're working, so regardless of their assignment, and they hear a call for service that's involving somebody threatening to commit suicide, they're going to respond to that call, even if they're not dispatched to that call. They're going to go and help. And on average, the CNT team it deploys to about 10 incidents a year, with the kind of a smaller contingent, not the full team, to specific incidents that we have. So if you guys recognize this was actually a call in Mountain View of somebody that was threatening to jump off of one of our overpasses. And it's a good example of the team that's there. Most of those people that you see, officers that are there, are our crisis negotiation team members. So the other thing that we did was we grew our team from the 9 officers that we had on the team to 15. So there's now 15 officers on the team that have that 80 hours of advanced training and all of the other expertise. And what that's done is that's allowed us to have generally 2 CNT members working every single day, 24/7. They're spread out among our patrol teams. Some shifts will only have 1, others may have 3 or 4 working, but because of the way our schedules work, there's a mesh of skills where we have multiple CNT members. The other thing that we did was we formalized the practice of self-deploying. So we did that by both setting expectations with the team directly, that the expectation is that you will, if you hear a call, go to it. And we're having them log on. So on the computer that they actually do all their work on, before they start a shift, there's an area where you could put special skills. Like if you're a translator or you have specific skill, language skills or other kind of things, they'll put that they are a CNT asset that can be dispatched to an event if they need it. So really the whole take on this is that we're using a resource and an expertise that we already have, that we've had in-house for decades. The next one, and she's going to kill me for having her picture here, but the next big win here is that we have one of our community service officers, Jody, who put herself, and there is a connection with MCRT here, so hat tip to MCRT as well. She put herself through school, got her master's degree, and is now a associate licensed LPCC, licensed professional clinical counselor. She's still a CSO with us, but what we've done is during this pilot, we've taken all of her regular CSO duties away and made her basically a full-time crisis negotiation team member. So her job consists of being at the police department and helping out with any calls that come out while she's there. And additionally, and actually most importantly, is she receives all of the reports and all of the incidents that come in that have any mental health component to it. She'll evaluate each one of those and then assign them, specifically assign each one of those to a CNT member for follow-up. And that actually brings us to the next piece here, is how the reports and the incidents work. So we developed a way to tag, for a better word, all of the specific incidents or calls, even if it's not an actual police report that was taken, but we responded to it with a way that we can have all of those incidents go to Jody. So they don't have to be formally a 5150 call or a police report with a case number. It could even be a medical assist with fire that we went to. It could be a proactive contact. Anything that has a mental health component to it, or the officer thinks maybe something's up, those will get forwarded to Jody. And then she, using her experience and training, she's also been a member of the CNT team for over 20 years and deployed to a lot of our incidents. She receives all of those and reviews all of the incidents themselves, and then again triages them, ultimately deciding which ones are going to need follow-up right now and ones that might need follow-up a day or two later, and then get them assigned to somebody for that follow-up. And some of the factors, these are just a few that she's going to consider when talking about the urgency to follow up on some of these, would be a history of weapons or threats of weapons, violence, dangers to others, drug use, the frequency of how often this person has been in our system, that comes into play, compliance in general, the custody status of somebody. Obviously, we're not going to follow up with them if they're still in custody. There's not a lot that we can do. And also the residence city, so where the person is laying their head. If a lot of people come to Mountain View that aren't from Mountain View, and we run into them. And if they live in Texas, for example, we're probably not going to follow up with them in Texas. But once triaged, those all get assigned to a specific CNT member. So very much like our detectives, the detective unit gets reports in and they get assigned to a detective. Jody is taking those reports in and assigning them to a CNT officer. And like we talked about, some of the subjects or the incidents themselves may need immediate follow-up. Some of them can wait a few days. But the CNT officer with another officer, or sometimes with Jody, just the two of them, they'll make contact and follow up with that person a day or two after we've already been out there. And those contacts basically are like welfare checks with kind of a social work component to focus on getting them, the person, or at least offering them again, resources or services they need. So you guys heard of some of the services that the MCRT team was talking about sobering stations, and there's more. There's connections with the VA, there's food, medical, even in Mountain View, CSA, all of the services that maybe at the time when they were escalated, they weren't really listening to the things that they have that we can offer. We'll get them connected with those again. And again, to come back to the beginning, the main idea is that this follow-up will help reduce the amount of repeat contact calls for service with that subject when the person's escalated, right? So it's better for us to talk to them and follow up with them when they're not. And that's where some of these other partnerships come into play too, because MCRT will help us with some of those follow-ups. And there's other Uplift Family Services, if they're juveniles, somebody asked about juvenile contacts as well, will also assist with some of the follow-ups too. And then this is a little bit of an aside, but something that we learned from the Lubbock, Texas Police Department, something as simple as even sending a card from the police department, believe it or not, following up with the person saying that we're here for you if you need anything. That has made a world of difference to them, with some very specific stories about how they've talked about that during another crisis event with that same person, and that was a de-escalation point. And then lastly is the metrics, is the numbers and how we're measuring this. So this right here, what you're seeing is actually stats for June. And to walk through it just real quick, we had 56 calls or cases that got forwarded to BSU. And I'm going to confuse things a little bit here. That little hashtag CIT thing, that's the code that we use for hashtagging our cases so that they go to Jody. It has nothing to do with crisis intervention training. They're separate things, and we'll get into that in a minute. Of the calls that we got forwarded, 19 of them were actually 5150 cases. 13 of them were actually assigned to follow up for our CNT members to go back out and talk to them. Of those 13, 11 were completed, and I'll get to the reason why some of this happened. 2 resources were provided, 2 were already connected with stuff, 2 declined when we went out and talked to them, 1 moved and was gone. 4 of them had prior months contacts that we had already been working through things with them. 2 are pending because we couldn't find them, or there's still some other mitigating issues that we need to work out. And then 3 of them were actually juvenile cases. And for those of you that are adding that up and say that doesn't add up, you're right. The reason why is we sometimes have multiple reports with the same person. Sometimes we'll have this multiple reports with multiple people that need contact. And sometimes they don't line up perfectly where we resolve the issue at the end of the month. It resolves in August and it happened in June. So the numbers are a little bit wonky. Plus we're only 4 months into this. So we're still trying to figure out the best way to collect metrics. To hit on the juvenile part as well, BSU also responds to a lot of youth mental health cases, and we do see quite a few, and anticipating more with opening schools and COVID and the pressures around all of the things going on with schools now. And in this, we work really closely with our school resource officers who often already have relationships with these kids and the school staff and their parents. And again, ultimately, that's to get the best help that we can for the kids in our community. And again, as I mentioned before, we also have a very, very close working relationship with Uplift Family Services too. That's specific to juvenile mental health. And then just some real quick things that I also wanted to point out. So this is where we're going to hit the CIT stuff, the crisis intervention training. Mountain View's very proud of our ongoing CIT program. We've been doing it for a long time, which is another common theme for those of you in MVPDX. We were doing CIT before it was cool to do CIT. What that is it's a basic level of training that emphasizes de-escalation techniques and empathy and communication. And more recently, the police academy themselves actually are certifying the officers while they're in the basic police academy with a 40-hour CIT training block. Obviously, we have officers like all of the officers that are here today that didn't have that in the police academy. So what we've done is we offer that 40-hour block during the year for them to be CIT certified as well. We were really ramping up and trying to get to, the goal was to have all of our police officers CIT trained minimally. And then COVID hit and training was cut across the board. CIT training was cut from that as well. So the numbers now have gone back down. We've hired a lot of people during this time and haven't been able to send them to training, but we do average more than half of our staff, sworn staff, is CIT trained. And even on our website, we talk about that exceeds the national average of 20%. So that's the difference between CIT and CNT team. And then lastly, we're still developing and tweaking the program, right? So as we go, but we have seen great success. There's one story that I do want to bring out, that we had one very frequent user of our system that was causing continuous disturbances in the community. People were calling, complaining, and he was causing a lot of issues, and it was requiring frequent police contact. Eventually, through partnership with MCRT, working with Jody very closely and our CNT team, we were actually able to get him finally the service that he needed in a more of a residential care facility. Additionally, we're seeing that cases that are being forwarded to the behavioral services unit are increasing as well. So we're seeing the police department using the services for follow-up as well. So even though it's only 4 months old, we are beginning to see the increase of that. And towards the end of August, where we are now, actually, it's going to be sort of middle of September is actually going to be the 4-month anniversary of our team. So at that point, we're going to take a little bit of a deeper dive into the metrics and the numbers to see if there was anything more that we could measure to see if we're seeing a difference in or a decrease in the overall recidivism and frequency, and potentially some other trends that are in there. So For those of you that know me, I'm going to end with this. Staying flexible, curious, and data-driven are really going to be the keys to success for this program. And it really, we're focusing on reducing the number of police contacts with people in crisis. And again, like I said at the very beginning, this is a really complex issue. We are doing the BSU thing as, we're really building the airplane as we're running down the runway here, because as MCRT is building out programs, as the county is building out programs, with the trust program that's being built, with the PERT models that are coming in, with partnerships being built with Palo Alto and even other counties, we still need something right now. And this is the right now fix for Mountain View that's worked the best with the resources that we already have. So with that, I know everybody probably wanted 2 hours of this presentation, but that's all I got. And if anybody has any questions, I'm all ears.
Okay, so I'll open it up to PSEB members for questions, and I'll encourage you again to keep it high level. If you have nitty-gritty questions, detailed questions and want to know more, I'm sure Captain Yeager would be happy to entertain an email or a call from you. Okay, so let me see if any hands are up. Member Tang, I see your hand. Please go ahead.
Hi, was it Captain Yeager?
Yes.
Thank you for your presentation tonight. I'm glad that MVP is like thinking of more like forward solutions, especially for mental health. I guess this is probably like a preliminary question because you're only like 4 months in. But I'm wondering how like your efforts could be sustained, because it's really lucky and fortunate that we have somebody who is a licensed professional. Not sure what the 2 C's stand for, but also a marriage family therapist. But I mean, like a lot of, not that you're presenting this to like other police departments, but like a lot of departments don't. And then like, what if Jody like leaves, transfers, retires? That's my question. Like, how do we sustain what you're currently building?
Yeah, so Jody's not allowed to leave. I will not accept any resignation or anything from her. And I think our chief is on the line as well. So no, in reality, that's a good question. In reality, there's a lot of questions about scalability of a program like that. So it works very well for our community. We would be able to function without an LPCC or an MFT or even a psychiatrist if we had a doctor kind of working. The people that are on this team have a very similar background to myself, which is almost 2 decades of working with active mental health crisis incidents. Although we're not clinicians, we can look at a case and go, we need to probably go talk to this person tomorrow. This person's really suffering. And in that model, what we're hoping is over time, programs like MCRT and other county programs, we can use them to augment that professional need of having a professional counselor there. That would be probably the most sustainable one, rather than having, I know Cleve likes to ask if like money and time were no issues, right? If we could do this perfectly, I would love to have a full-time psychiatrist and a full-time psych staff to even help with police officers in general, and then also to reach out for the community. But the reality of it is one of the other themes that came out of our research was staffing. And I can't see the MCRT people here, but it's really hard to find clinicians, and especially in general. And then it's really hard to find clinicians that are willing to step into a non-clinical environment like the street, and where it's kind of dangerous sometimes and people are not at their best, acting in their best behavior. It's hard to keep people like that as well. And then you're dealing with county salaries and budgets and other kind of things that compete to steal people away to private practices and stuff as well.
Thank you.
Thanks. Vice Chair Frank, please go ahead.
So the question that I didn't get to ask Sandra and Jean was response times. So obviously you're a city department and you're here with us and you have lots of people who are available to respond to these events. So what is response time? And I would imagine that because Sandra's team is more county-based, it's a little larger, but I'm really intrigued, Sandra, I'm sort of Bogart this question, but I'm intrigued by the idea of expanding your force, but having them live and work remotely so that they're sort of spread out around the county, and then their response times aren't an hour or so. I would imagine in our city, you could call 911 and one of Saul's team would be here in minutes and maybe even seconds, depending on where you live. That kind of response time is probably not going to be possible for a county-based system just because of life in general and reality. But I really would like to know like what your general response time is, Saul, and how you do that. And then also, I feel like it's like we as a community I feel like this is how we got into this first place is, well, it costs too much. We always say it costs too much to just have what we need. Like if we need it, then we should just pay for it. We should figure out a way to pay for it. It's what we need. So if we need to figure out a way to find some psychiatrist to run a team here and have a staff, we should figure that out because the folks that they would be serving would, in my opinion, be worth whatever that cost. Sorry.
Okay. No, that's good. So I can kind of answer both of those. Yeah, response time, obviously we're open 24/7. So you could call right now and there'd be officers that would get there. And chances are there's one or two CNT officers that are going to respond. MCRT, during, pre-COVID, it was difficult with traffic, right? So traffic itself presents an issue. But the biggest problem that we're running into in regards to funding, and I kind of say that laughingly, the reality of if it is, with a lot of research and look at the amount of calls that we have for service, to say it plainly, there's not necessarily enough business in Mountain View to justify having a full-time clinician here. And that's the beauty of having a county-run team that can respond to the whole county. San Jose might be sort of the only one that may have enough business for them to be doing that to justify a full-time one. So I kind of say it in jest that I would love to have somebody here. The reality is they wouldn't be doing a lot very often. So it would be probably better served in a different model. But response time for MCRT has improved. There were some issues early on with just in staffing with them and that kind of thing, and traffic, basic logistic issues. But the reality is the police officer is probably going to get there first in an active incident. But we are seeing ones now where MCRT would call us after they're somewhere and they saw something strange or something, and then they need a police officer there, and we respond. And that to me is a very healthy partnership that's built. I hope that answers it, Cleve.
Were you also asking for the MCRT response times? I'm sorry, I misunderstood.
No, I didn't get a chance to ask that earlier, but okay. Yeah, it's okay with the chair for you to respond. I would love that, but I was just going to email you later.
So yes or no? I'm not clear. Yeah, respond now. Okay, so we have been running about 17 minutes in the past. More recently, with everybody going back to work and everything, traffic is an issue. It is about right now, at last look, was about 31 minutes. But we're expanding staff, and it's nice that staff do live throughout the county, so that helps. But yes, traffic is an issue.
17 minutes is fantastic.
And Mr. Frank, my first name is pronounced Jan, like Jan. But in terms of trust, the aim is with the procurement process with the on-site field team, the aim is to once a call comes in and it requires a dispatch to the location of the caller, that the OFT for short would be able to be deployed within 30 minutes. So it was really essential within the RFP scope of work to state that the home base location of each provider or the providers proposing that there's a home base in North County, a home base in San Jose, and a home base in Gilroy, so that they can respond appropriately in a timely fashion.
Thank you. Member Wang, please go ahead.
Thank you. I was wondering, Captain Yeager, if the team or if the police department has considered having someone who is non-uniformed or like a therapist or someone similar to those on the MCRT team to also go with the officers when they follow up with those people. And also, I was also wondering how often the BSU calls the MCRT and kind of separating mental health from police department stuff. Thank you.
I'm writing it down because I can't remember two things at once. So non-uniform personnel. If sometimes, so Jody is professional staff. She's not a sworn police officer. She's been on, like I said, she's been on one of the non-sworn people that have been on our crisis negotiation team longer than I have. And so a lot of the follow-up she actually goes to herself. And we've already made contact with this person. So the follow-up is just that, it's follow-up. So we already kind of have an idea of whether they're accepting or not of the person that's there, who they're going to connect with better and who they're not going to connect with better, potentially, right? There's always a risk involved. We can't predict everything. So sometimes she'll go, sometimes she won't. I don't know if that answers your question, but yeah, we've looked at that. But most of the calls so far, again, we're only 4 months into this, although we have been doing this already informally for a very long time. The uniform doesn't usually get in the way because of the way that they're actually contacting people. It's very non-threatening.
And sorry, my second question was, how often does the BSU call MCRT for?
Yep, I actually wrote it down and then I forgot I wrote it down. Sorry, it's been a long day. So I don't have the exact numbers, but Jody actually works part-time with MCRT. So she's very connected with them. That's why I was winking at them when we were doing the presentation. So she works part-time there and is working through licensure through them as well. But the MCRT is contacted pretty early in a call. It depends. And that contact to MCRT or request for their services, when it first started, happened very late in a call. Now it's happening almost one of the first things that we do, even before we're getting there. A lot of our patrol sergeants will recognize that, maybe this is a barricaded subject. The first call that they ask, or the first thing that they ask our dispatchers to do is call MCRT and have them start. So start coming to the call. We can always cancel them. It's very similar to, without getting into details, but like we may start fire and paramedics even before we are rolling there to a call. It's easier to cancel them and not need them than it is to need them and have to wait. So sometimes that'll mitigate or reduce the amount of time it seems that MCRT is going to take to get there, because by the time we figure out what's happening, they are rolling up to the scene. So like I kind of alluded to at the beginning, we're still sort of figuring out how we all work together in this thing. I don't have the numbers for you though. I apologize, but I mean, I feel like we call them a lot for things, and then it's resolved before we need them or before they arrive.
Thank you.
Member Langton? Go for it.
I'll make it short. I think the number of resources that I've seen allocated to behavioral health between Santa Clara and Mountain View PD is far beyond what most communities have. I think it's great that they're still trying to iterate and improve, and just the amount of interest from the PSAB and all the questions that they've asked, the intense engagement in the topic, I think says it's going to grow, it's going to evolve, and we're going to do quite well at it. Thanks for all the feedback from the board and the presenters.
Thanks, Dirk.
Thank you. Any other questions from PSAB members before I open it up for public comment? Okay, so at this time, would any of the members of the public like to make comments? Again, I would encourage you to keep your comments high level and constructive. Given that we are already 2 hours and 20 minutes into our call, I'd like people to limit their comments to 1.5 minutes, please. Let's see here. Okay, Mr. McKenzie, please go ahead.
I want to thank county representatives for coming here, telling us about MCRT and trust. I am glad to hear about these new programs coming out. I don't know how many times since I've lived here, I've been on the Caltrain and we've had to stop because someone took their own life. And I'm glad to see that we're investing in resources that can specifically target mental health, and especially with trust. It sounds like it's upstream. I really appreciate Vice Chair Frink's question about kind of going upstream at the dispatch level. I know later on there's a discussion about the work plan to be adopted. It does seem like intrinsic within the mental health response is the question of how do first responders get allocated. So I'd hope that that is something that's considered as you move forward. Thank you. I look forward to seeing these mental health resources continue to grow, and I hope we can continue to invest in them.
Thank you. Ms. Connor, go ahead.
Hi, hello again. So these are all great programs. I would love to see that doubling of staff, at least, that we talked about. I know that's a county thing, not a PSAB thing. One thing so I've noticed, I've been in, I think now several forums where we've learned about the county mental health response and local mental health response. And I hear the same questions asked almost every time. And I'm sure the representatives from the county are aware of these, but there's questions about youth and some confusion about whether or not youth can be served by these programs. There's questions about dispatch and can it be through 911 or something simpler. And there's, I think, generally some confusion about when to call which program and which program is appropriate for what thing and how you're going to figure that out when you're in a crisis. So I think there's obviously some opportunity for streamlining, but I also think maybe, that might take some time. And one thing we can think about in Mountain View is how to get that information really clear so that anyone in Mountain View who needs it has it and understands what they need to do. Thanks.
Thank you. I do not see any other hands from the public at this time. So I'd like to go back to PSAB and see if there are any other last comments or questions before we move on to the next topic and let our presenters call it a night. And just a reminder for everyone, please keep your comments high level. If you have any detailed questions, we can connect you to the right folks. Member Wang, I see your hand up.
Thank you. This is really quick. I just want to say, I think we'd be really interested in hearing from Uplift as well. I don't know if that's something you could coordinate, Melvin, but that'd be great. Thank you.
Yeah, it sounds like PERT might be on that docket too. And I certainly need an updated slide, Jan, from you with PERT, MCRT, CMR, Uplift Mobile Services, and BSU. Please, that I will put it on my wall. I'll be so excited. Okay. All right. Any other questions from PSAB at this point? Okay. Thank you, Captain Yeager, Ms. Morale, Ms. Hernandez. We appreciate your time. Mr. Gaines, I'd like to propose a 5-minute stretch and bio break before we move on to the annual report. Would that be okay? Purely selfish reasons here. All right, let's take a 5-minute break. I'll see everyone back 9:30 sharp.
Jeanette, what kind of art are we talking about back there behind you?
Me?
Yeah.
Oh,
back-
this
oh,
is
back-
brainstorm.
Oh, sorry. I didn't know who Cleve was asking. Sorry.
I didn't realize you'd come back yet, so I was just wasting time.
This is my brainstorming for my college apps.
Oh, cool.
So it's just all on poster paper. Yeah, it's not art. It's my life.
Just in case y'all don't know, we're still alive.
I did know, but
Yeah, we have to be somewhat at least informal once in a while.
yeah, I ain't shy.
Yes, indeed.
All right.
Kavita was frozen. Okay.
Okay. Welcome back, everyone. We are moving on to agenda item 5.2. I see the chief is dressed up for us. We appreciate that. We're going to receive a presentation from Chief Chung on the MVPD annual report. You should all have a link to it in your agenda.
Thank you very much, Chair, IR, and Vice Chair and members of the board. Good evening. It's my pleasure to just present our annual report. I'm going to keep it high level and just touch on some themes. Before I do that, it's probably good to set the context and just recall that this is an annual report snapshot for January 1 through December 31st of 2020. So we are living in pandemic years, so that actually could seem like a long, long time ago. So that some of the questions that you might have, like you might look at the organization chart and wonder why you see Chief Max Bozell on the org chart. That's because he was the chief for Mountain View PD during that calendar year. So I just wanted to also highlight, as you look on the first few pages, you'll notice the diversity in our department. I wanted to touch really quickly on hiring because that topic comes up a lot, and just to spend a minute to explain what we look for in officers when we interview them. And for me personally, I look for people who have servants' hearts and really look for putting the needs of others before themselves. And a lot of emotional maturity and professional maturity and life experience goes a long way. And I think we see that in a lot of the interactions that we have. And I'm really blessed to have a department full of people, both in our sworn ranks as well as our professional staff. As you look at the pages, about pages 3 through 7, you'll see a lot of the different crime trends. The pandemic had an interesting effect. And if you'll recall, the pandemic started in about March of 2020. And if I use the analogy of the traffic flow on the freeway, if you'll recall, March, April, it was like a ghost town out there on the freeways. And that was a similar effect in the city where just almost everyone was indoors. And I would venture to say the criminals were as well. So we saw a marked decrease in the number of calls for service that year. It did, of course, pick up towards the end. But in general, most of the crime trends, both person crimes and property crimes, are trending downward. As we flip through a few more of the pages, and you'll see on page 12, there's a lot about contact data. And I don't really want to go too far into that as because that snapshot is very one-dimensional compared to the presentation you're going to get after this agenda item from Alex Stevenson, which is, I would say, way more deep and broad and detailed in the look of that. Happy to answer any questions you might have about it if you do. If you're noticing some of the numerical differences between that and something else and Alex's data, our data in the annual report actually includes parking citations. So it's an apples to orange comparison, because in ours we have parking citations as well as traffic stops, parking citations and traffic stops, but his does not have the parking violations in there. So I wanted to call that out. Page 15 talks a lot about our complaints. Excuse me. And you'll notice just the numbers there, relatively low, I would say, compared to the 22,000 plus contacts that we've had. We are right now evaluating a new kind of software. The software that we use to track our complaints is rather old, and the new one we're looking at actually is a lot more transparency focused. in that it would have a forward-facing, public-facing portal in a sense that would allow the public or you to just basically go at any time and data mine whatever you wanted and find out, as opposed to waiting for us to push out an annual report. So that's to be continued. And lastly, as I look down here, on page 17, it talks about traffic accidents, and that too, I think, was influenced by the pandemic and the lack of cars just anywhere. So naturally, you can see a dramatic dip in the number of traffic violations as well as traffic accidents. And as I rounded out, I just wanted to call attention to the PAL program. Even during COVID in 2020, the youth service officers were able to do a COVID-safe summer program, very much more restrictive than normal, that focused on 4th through 8th graders. And we were able to serve 83 children during the summer, which I think went a long way in terms of just mental health and giving them something to do outdoors in a safe manner. And lastly, I think many of you are familiar with our Neighborhood and Event Services unit. This is the unit that has the primary responsibility of dealing with our unhoused population. For those of you who've had the pleasure of meeting Officer Janlea McPherson, you'll know right away that she has a servant's heart, and she just really enjoys getting to know and serving and connecting people with the various services available in the city and the county. That unit in 2020 was able to hand out over 700 gift cards. We partnered with a nonprofit who was able to get us $50 gift cards, and we were able to get over 700 of them out to the community, as well as 2,700 food bags and 530 hygiene kits. Not to mention, I think almost 10,000 masks distributed. So it was a busy year. It was a very different year because of COVID, but very proud of the women and men in the department who really are very adaptive and really thrived and just worked together to serve the community. So I'll turn that back over to the chair, and if you offer up any questions that the board might have.
Thank you, Chief. So I'll open it up to PSAB members. Do you have any questions or comments for the chief on the annual report or otherwise? I do not see any questions. How is that possible? There we go. Member Langton, thank you. Please go ahead.
Oh, yeah, I don't want to, I've been trying to hold my voice so like the meeting goes along, but I also don't want the chief to feel like we're not at all interested in the content that he just dispersed. And yeah, I'm just going to give a positive comment. Thanks for your information. Yeah, I agree. COVID had a significant impact on policing, and yeah, and let Sandhu give his feedback.
Member Sandhu, please go ahead.
Thank you, ma'am. Thank you, Chief, and thank you, Mr. Langdon. Just a couple of things. It's very, very good to get reports like this. More the better. More data we get as time goes on, be better. But to make light of the situation when you say March and April, there's no traffic, so everyone is home. I saw a little caption, maybe you can enjoy. A burglar goes to the unemployment office and fills up a form, and a reason for unemployment. Everyone is at home. With that, I'll end. Thank you.
Thank you for injecting the humor, Member Sandhu. Vice Chair Frank, please go ahead.
Sure. I just have a question about the K9 team. And I've asked this question, Captain Yuga, before, but I can't remember the answer. And the question is do any of the dogs that you have bite? In other words, are they used as attack team members? And then also, how do you guys, like, if they are doing that work, how do you keep them safe? Like, do they wear like protective things? I've seen that a lot lately.
Sure. Thank you for the question. So broadly speaking, there's apprehension dogs, which would be the stereotypical kind of German Shepherd or Belgian Malinois. There's also detection dogs, beagles, golden retrievers and such. So we do have apprehension dogs, and they're German Shepherds. Within that category, there's two general broad training methods. One is find and bark, and one is find and bite. So I'll explain both. Find and bite is basically the handler sends the dog, and whatever the target is could get bitten. The other school of training is find and bark, meaning you're sending your dog out to search or sending it after someone running. The dog will run up and bark at the person until it's given a different command, a specific command to bite. That's what we do. We do the latter. And we've had that training methodology for as long as I can remember. It's a very standardized training. The state sets the standards, and we have to certify on a regular basis and document all the training.
That's cool. As a victim of fights, even for a criminal, I don't really wish that on anybody. And then I was asking about so for those scenarios where they have to go and find somebody, are you able to protect them from possible harm?
It's tough because they do have like ballistic vests out there for the dogs. That kind of tends, it's like anyone else. You don't always like wearing heavy coats or everything, and we don't generally deploy them with that. The handler has the ultimate discretion. If it's a situation where the dog is a high danger of getting hurt, then the dog maybe doesn't go, right? It's very much the closest thing to a human partner that we have, and we wouldn't want to see them hurt as well.
Thank you.
Mm-hmm.
Other questions from PSAP board members before I open it up to public comment? Okay, I'm going to go ahead and open it up for public. Oh, I'm sorry, Vice Chair Frank, is your hand still up? I'm sorry.
I had one more question, and I wanted to ask about the PAL program, specifically. What are the most you guys do boxing and some other things. What are the most popular programs that you guys are running?
Right now, it's the boxing, although that took a backseat this year and last year, obviously for obvious reasons in the pandemic. But outside of that, the summer Dreams and Futures program is very, very popular because it's two different cohorts of 2 weeks each of at-risk kids identified. We partner with the school district who tell us, these are the kids who, for a variety of reasons, and they just have a blast. They get to be kids. They get to I think the day I visited, they were the counselors had named each of the SROs kind of a goofy name, butterfly wings and bubblegum, whatever. And the kids just have a blast making fun of the officers, and they're playing soccer and throwing balls at each other. So that one goes back decades, and it's just been a hit for everyone that's gone through that.
Great, thank you.
Mm-hmm.
Member Kang, please go ahead.
Hi, Chief Sung. It is Chief. I'm sorry. It's really hard for me to keep police titles.
That's okay.
Okay. I'm looking at the contact demographics, and I guess just a clarifying question. Did you say that Mr. Stevenson was going to do a presentation on those?
Yeah, so the data that he has is not just 2020, but it's all encompassing. I think it's a 4 or 5 year snapshot, and it does include 2020. But what I wanted to call out to the board was the data that you see there includes parking tickets. So I think about 16,000 parking tickets. So that would, in a sense, if you're comparing it with what he has, it would actually not be a direct comparison because his data does not contain parking tickets.
Are the parking tickets included in like the citations data? Is that what I'm looking at?
Yeah.
Okay, thank you.
Mm-hmm.
Okay, with that, I'll open it up to public comment. I am not seeing any hands up, so I will return to PSAP for any final questions or comments for the chief.
Through the chair, you gotta, oh, he disappeared again. It was your friend Alex Brown, but I think he lowered his hand. So.
Alex, don't toy with my emotions. It's not polite. All right, I don't see his hand up, so we are going to come back to PSAB and see if there's any other comments or questions for the chief before we let him go. I don't see any, so Chief Jung, we thank you for your presentation. We appreciate it. If there are any other questions, as people have time to digest more of the data, where would you recommend they direct those to?
I'm happy to answer any questions. I know Captain Canfield, Captain Jager, we're all happy to be on the receiving end of an email or a phone call to answer any questions the board may have. But actually, Captain Canfield being the staff contact for PSAB would probably be the most logical first step.
Okay. Member Brodowski, you had a question?
Yes, for Chief Xiong. Tell me about the vaccination status of the people at the police department.
I believe the last snapshot we got was of the officers was 82% and the professional staff was 92, I think. So on average, it was 86%. That data might be a week or two old, but that's the last that I know.
Do you think you can do that a little better for the sworn officers?
We're always encouraging and very much mirroring a lot of the messaging that we're hearing from public health, from county, and encouraging those to be in the department to be vaccinated.
I've had some proposals that we, as PSAB, recommend that you mandate vaccinations. Do you have any comment?
The topic of mandating actually is being looked at a citywide level. So it wouldn't be just the police department. So those discussions are taking place. And I think the city's looking very closely at the direction guidance from county, state, and federal.
I think that answers my question. Thank you.
I think you're muted.
Darn it. Every time, every meeting, I'm like trying to do it. Anyway, sorry about that. I was just effusively thanking you, Chief, for your time and your presentation. And with that, I think we can close this section of the agenda and move on to our third item. Thank you. Okay, so 5.3 is a presentation from research fellow Alex Stevenson on his work to assess disparities in traffic stops. Mr. Stevenson, welcome back. We look forward to your presentation. You can begin whenever you're ready.
Thank you, Chair, and members of the PSAB, as well as the public who are still here at 9:50. To respect the time of everyone, I've chosen to very quickly summarize what I discussed last time I came here, provide some updates of questions that the board asked, and then focus the kind of remainder of the presentation on some of the potential things that the PSAB may wish to consider in terms of, if I have the correct verbiage, Melvin, please correct me if I'm wrong, in terms of building work plans and next steps. So from last time, and just a recollection of this project is looking specifically at traffic stops, as Chief Jung mentioned. One of the advantages of traffic stops, he was noting sort of one-dimensional nature of contact demographics, and that is in part due to the way that some of that is reported out, but predominantly we're dealing with citations. And so that's a subset of all contacts. One of the nice things about traffic stops is it happens to be the only data that the department itself has been able to keep track of, though I'll mention in the recommendation sections, one of the things that's legally changing in that respect that will expand data collection from the department. That went back consistently, not only in terms of years, but also captured people who would not receive citations, for example, just warnings. This report is looking at the three related questions that hopefully is being shared on the screen for everyone. I want to highlight that This presentation will spend more time on the third bullet point, but I'm of course happy to answer any questions about the project itself, as well as any continuing questions from the last time I was able to kindly be asked to come speak with you. So the project looks at disparities that might exist at the officer and motorist level. That's an important, one could think of it as a limitation, one could think of it as a focus, depending on how one is looking at it. But we may, of course, always think of potential disparities at other levels. So for example, we might think of disparities between cities. We could think of disparities that may exist as a result of differential patterns that may exist in a city. So for example, based on calls for service or sort of 911 calls, euphemistically, there's a lot of reported crime activity in one area of Mountain View. This leads to a feedback where officers are in that area more often than they may be otherwise. And so consequently, assuming they are in some sense doing their job, are more likely to spot potential criminal activity or potentially stop individuals. That is a very difficult problem to get around. It is not one that the city data, and particularly the police department's data, lets us really dig at. And so what we can, however, talk about in terms of disparities is the specific individual officer and individual motorist decision. And that's why we focus on that in this project. We can evaluate that at two areas. One, we can evaluate at the stop decision. And here I put in parenthetical from my last presentation. These would be sort of veil of darkness tests we might think of. And the veil of darkness test very quickly is just a test that takes advantage of the fact that daylight savings time moves the amount of light that occurs at a specific part of the day at different points of the year. But if we assume that the underlying traffic patterns haven't changed, we have in some sense approximated a random experiment where the treatment is whether or not an officer can see the driver. And the implication of a veil of darkness test says, if we are in a situation where, for example, officers perceive individuals of color, they're more likely to be able to see the driver during the day. So if individuals of color are stopped less often by a department when it is dark, an implication of that might be that that is a sign of potential bias or discrimination on behalf of officers in that perspective. The second place that we can look is at the search decision. These generally defined, we think of these as outcome tests. And so outcome tests in this context are, given that there was a search, how successful was that search? In terms of looking for discrimination, we'd prefer officers, at least in the context of this project, to be equally good or equally bad at being able to be successful, or in other words, have a hit rate, a high hit rate between perceived racial groups. Another way of saying that is we'd like, if we truly had no bias or discrimination, what we would see is that the perceived racial group was uncorrelated with the hit rate decision. So we wouldn't see differences between the two. This is the overall review of findings from the project. There is no clear evidence from our veil of darkness tests in the window for which they are informative that MVPC stop decisions are discriminatory. And what I mean by this is that in part because of data limitations, and by data limitations here, I mean the city of Mountain View in general does not conduct a large number of traffic stops. And so there are simply not that many data points that we're working with relative to what a researcher might want to be very precise in this estimate, which is separate from a normative question as to whether or not the Mountain View Police Department is stopping too few, just right, or too many Goldilocks style in terms of its stop decisions. This project does not have any comment on that question, and I am happy to say I'm not qualified to answer that question. That's a community question. But what we can say is that we are unable, we failed to reject the null hypothesis that there is no difference between stop rates when it is day, so what you could see when it's light, versus when it is dark, and so you couldn't see. If anything, the evidence, if I had to guess, would suggest actually that non-white individuals are more likely to be stopped when it is dark out than when it is light. But the variance, the standard errors on those estimates are very, very wide. The confidence intervals as a consequence include 0. And so the way we would think about that is we actually do not see evidence that would suggest that there is any sort of clear sense of discrimination in that regard. In terms of search decisions, we find some mixed evidence of disparities in outcome tests. This depends on both the year and the relevant group comparison. There are 2 reasons for this. Both are related to data limitations. Again, here, data limitations is actually referencing the fact that the Mountain View Police Department does not conduct very many searches. And in terms of its total rate, it conducts about, I believe, 2 to 3% of all traffic stops will result in a search. Of around that 2 to 3%, that is, of course, if you stratify, i.e. you break it up by perceived racial group, you will have even smaller numbers. So in certain years, for example, there are no searches of individuals who are perceived by police officers and therefore entered administratively in the data system as of Middle Eastern descent in some way. So if you wanted to do a hit rate test, you would simply not have the data to do it. We also see noisy estimates, and by noisy here, I mean they could fluctuate quite widely if we just switched a couple of those failed search decisions to successful, or vice versa. We switch some successful to fail. And so what I would take away in terms of this disparity number in general, and certainly when the full report comes out, you'll be able to look in more depth to those particular comparisons, is that there is not a strong sign or a strong consistent sign that the Mountain View Police Department is overtly discriminatory in its search decisions. But we do see, depending on the year, some mixed evidence of disparities. As I said to begin with, when thinking of outcome tests, we'd like the police department to be equally good or equally bad across racial group, perceived racial group comparisons. And that is not the case. In some sense, that is not surprising just for individual fluctuations. But that does see that there may be some, at least some minor evidence of discrimination, or at least disparities, not necessarily discrimination as a result. The last time I was kindly asked to speak, there were some questions from the council, or sorry, from the PSAB. And so I'm going to answer a few of them that I had written down and then had looked up here very quickly. So what you hopefully are seeing on the screen comes from the annual report, so you can look at that figure as well. But these are the beats in Mountain View, and there are 4 beats in Mountain View. The police department divides up its services when sort of thinking about reporting requirements. Beat 1 is in the southeast, beat 2, and sort of going in a counterclockwise fashion. One of the questions that was asked last time is what neighborhoods and beats do we see most traffic stops in? So the next slide here is a table of numbers. Tables of numbers I know are sometimes like, oh, there's lots of numbers. So what should you take away from this chart? Well, in general, the most common beats for which we see traffic stops are in beat 1 and beat 4. So to go back, most traffic stops are occurring sort of around the downtown region. But they're actually even more specific than that. They're predominantly running around the major choke points or cross streets within Mountain View. So running down across the Central Expressway. To visualize this, this is a plot of every single traffic stop in the data set that we have. There looks like a whole lot of dots that are sort of clustered right on major highways, as you would expect. The other thing about this particular figure, and I recognize that it seems a little bit busy, part of that is due to the way of plotting points. These points are jittered. And by that, I mean they're moved a little bit from where the specific lat long coordinates are set up. So in order for you to be able to see them. If they weren't jittered, wherever you see large amounts of density on this graph, so for example, I'm not entirely sure if my cursor is showing, but if you look at the very middle of the graph, there seems to be a whole lot of points right in that very middle. To pop back up very briefly, that would be the equivalent of sort of right here on the graph, this sort of very middle where the primary two roads in Mountain View connect. That accounts for a vast majority of all traffic stops. And depending on sort of where exactly on, you will get something in beat 1 or beat 4 as a result. In certain stops, it almost seems like the side of the street that you are on when the lat long was determining it will make that decision. In terms of a second question that was asked from at least a member of the board was the number of stops that were residents or commuters. Based on the data that we have, or at least the police department has, to be clear, when I say we here, I mean the police department. Based on the data the police department has, that is not a question that can be answered effectively. And the primary reason is not simply just a driver's license question, but rather the limitation is that pieces of paper or reports are not generated on people who have simply been warned. And so consequently, if a traffic stop, the vast majority are initiated based on some form of moving violation, which is another question. And then the subset that are non-moving violations are usually a mechanical violation of some kind. But if that is initiated and it's simply, the officer in some sense warns, you should get the taillight fixed, for example, that we no longer have any sort of record of who that person is. That you compare against. And so consequently couldn't tell specifically, these are how many residents versus these are how many commuters. For my personal thinking about this research perspective in terms of the veil of darkness test and our outcome tests, residency could potentially, we could think of it as a confounding variable in the sense that if an officer realized someone was in Mountain View, perhaps they would act differently. I don't have any evidence that this would be true. And so consequently, we could think simply by looking at the stop decision, if we're worried about potential areas of discrimination, because until an officer speaks with a motorist, they have no understanding of where they are from necessarily. There were similar questions that were related to the make and model of cars, and that unfortunately leads to the same answer that is associated with the sort of warning question. There isn't a record unless there's a specific citation, potentially a car impound of some kind, of what kind of vehicle someone is driving. And there's a reasonable question that may be asked, which is perhaps officers may proxy, if you believe that there's perhaps discriminatory behavior going on, perhaps officers proxy vehicles in some way. And so they utilize certain kinds of vehicles and are likely to stop those vehicles. And that may be correlated in this case with race. But the decision may not appear, and yet that's happening. Unfortunately, the sort of data limitation here is that we do not have consistent evidence on the vehicle, in particular for all of the stops that don't generate a report, so beyond a warning. There was also a few questions. One question was how many traffic stops result in arrest? Very few of them. The number is less than 2%. I believe it's actually closer to less than 1%. And if of those, at least some of them seem to be stops that were explicitly made to have an arrest. And so that's separate from, a traffic stop has occurred, and then in the course of a traffic stop, an arrest occurs. And so if you pull those out, it's an even smaller number. But we're talking a very small number of the overall traffic stops. Indeed, the vast majority of all traffic stops end in simply a warning. That's the general disposition that occurs at the end of it. There's no arrest, there's no citation, simply a warning is the majority of stops, though not an absolute majority. Finally, there was, sort of a question perhaps about neighborhood biases. Do we see certain neighborhoods have them more? While I won't comment on that specifically because there may be sort of specific neighborhoods that individuals are looking at that they think may be more or less biased in some capacity. What I will say, when you look at the traffic stops, that the primary place that traffic stops occur are places where there is lots of traffic. As Chief Jung mentioned, in 2020, in the data that we have about officer-initiated traffic stops, the total number of traffic stops was cut by about half. And so it went down from about 7,000 traffic stops to about 4,000-ish traffic stops. And so traffic in some way also very much responds to who is on the road at a given period of time, and traffic may also respond to the needs of the department. For example, traffic officers in my interviews with various members of the department, traffic officers seem to be some of the first officers who are pulled from their primary duty to perhaps assist something else. For example, if there is an emergency that requires additional officers. But the experts to speak on that issue are members of the police department, not me, for more specific points on that front. So the final part of this presentation, and thank you for generous use of your time as we hit 10 o'clock, is sort of recommendations out of this report, what we might think of. And I mentioned a lot of times so-called data limitations. And when I say so-called, I don't mean like, oh, they're not problems. I mean, some of them are problems that no amount of additional data would be able to solve. Even if we had, to use the vice chair's question, infinite resources. There are some questions that we simply cannot answer because we don't have the ability to access it. But there are definitely data improvements that could be made. And perhaps fortunately, both for the department and as well as the public, many of them have been mandated by law in the Racial Identity and Profiling Act, AB 953. Mountain View is required to begin collecting RIPA data beginning in 2022, on January 1st, in fact, of 2022. That was mandated by law due to the size of Mountain View as police department. Mountain View will be around, Mountain View and about 400 other police departments in California will all begin collecting this data. The wave one, so the largest police agencies, for example, San Diego, San Jose, and Santa Clara County, Los Angeles, have already been collecting this data, and this data exists online. But one clear recommendation that I think that is advantageous is that RIPA stops expands the definition of stop in some sense to include any stop that officers make. And so that may give us some purchase on looking at individuals stopped. Right now, we only look at motorists. Furthermore, RIPA collection data also asks for more than simply the driver. It's possible, we may imagine, that the reason a police officer stops a vehicle isn't simply because of who is the driver, but rather the vehicle in totality. So who might be riding with the driver. Right now, the data the department collects, certainly as you go back farther, never seem to collect that. Not that there's a reason necessarily it should have to be clear. That's not a criticism of the department's data collection. It merely means that's a limitation if we wanted to ask a question about, well, who else was in the car? That's not something the data can speak to. Beginning in 2022, that's not true. However, because there are quite a few potential data elements that can occur based on a RIPA stop, a reasonable question that I think is important for community input is to figure out what kind of data should be reported. At what level in terms of speed, so how often should that data be reported, and how easily available should it be? My general view is that there's potential to explore ways to make MVPD data open and available to the public. There are, of course, legal concerns that are just generally associated with data that may lead in some sense to a criminal prosecution, personal identifying information of both residents and police officers. As community members more broadly need to be protected. But open data is helpful. Providing ways of creating more open data, I think, is advantageous. And because a lot of the RIPA data collection needs to be mandated by law anyway, being able to explore questions that might be explicit or of interest to the Mountain View community itself, because there are many data elements, could be useful. There already appears to be at least some open data collection within the city, by which I mean you can look, for example, GIS files or various aspects of open budget. I recognize, and perhaps one of the advantages of my position as an outsider, that it's very easy for me to recommend things and not have to worry about budgetary implications. So I will point out here that all of these would certainly use staff time, and staff time always seems to be limited in these situations. But so perhaps the PSAB could, if it was interested, think of ways of perhaps having economies that could allow it for publishing data. And the final one is ways to partner with the community. So utilizing the advantage of PSAB as an advisory capacity, if this was something the board was interested in, to determine additional data sharing that may be useful in the future. So for example, the questions that come out of the annual report, is that the optimal use of data? Is that the optimal reporting to the community so the community is informed and able to make decisions? Like anything, that of course does change and use staff resources. But I think these are all things for which, when I was thinking of where you take this next, to be able to continue to evaluate the same questions that we're asking here, because the underlying mechanisms or machinations of the tests that I've done don't change. It's just data would change. So if you have more data is better. And then also expanding that up to improve transparency, which I know is a stated value of the department, so to be responsive and be transparent with the community. And so with that, thank you very much for your time, and I yield back to the chair.
Thank you, Mr. Stevenson. So let's start with questions, comments from the PSAB board. Again, please keep your comments constructive and high level. If you have nitty gritty and want to do data dives, I'm sure we can put you in touch with Mr. Stevenson. Member Langton, I see your hand up. Please go ahead.
Yeah, what's your thought in breaking out the 2020 data, basically the COVID portion of, and could that provide an interesting look into, because it was such a smaller sample, and like would that provide some an interesting data set compared to everything before?
And it's an excellent question. It's something that I've been trying to think through over the last couple of weeks. So for example, if you were, say, skeptical of the stop decisions, so you think that the noisiness and the point estimates are going the wrong way, that actually we should see fewer persons of color, perceived persons of color being stopped after. One possible reason for that might be that in 2020, traffic patterns changed, and that's entering the data. So one thing that I is on the agenda to do is to do the exact same thing, removing 2020. The hard bit, and why 2020 is currently in the data, to be transparent, is that's what we initially discussed doing. So that's the test that was run, because that's what we said at the beginning. And so changing after, just because we liked or didn't like a result, would perhaps not be the most transparent without being clear about it. But the other question, at least for me personally as a researcher, is do some of the underlying assumptions even apply in 2020? It's hard for me to believe necessarily that the traffic patterns that we normally see in the beginning of 2020 and the traffic patterns we saw at the end of 2020 are the same in the ways that I think we can be more comfortable saying that in, say, 2016. And so that would call potentially into question, just for that, if you're only focusing on that as an individual year, utilizing something like a veil of darkness test. You also get substantially fewer searches in general. And so what data you're getting out of 2020 is challenging. But I do agree with you, Board Member Langton, that it is an interesting question. For me, it's a hard, interesting question because of what is the most appropriate way of dealing with something that is already in an observational space, by which means we didn't get to control how police officers came to traffic stops. And so there may be whole hosts of reasons why they are showing up. And that is always a challenge with this kind of work.
Yeah, if I could just follow up, my kind of assumption on like the particular 2020 is the people that were on the road were basically essential workers, I think it's just an interesting filter to see, just that group of people kind of and how they were engaged with law enforcement.
Yeah, I agree. And certainly every one of these tests we can think of as a descriptive representation, in the sense of like, here's what the police department did. The second step in terms of, is this evidence for discriminatory or practices of disparity, or is this evidence against that, is the question that becomes trickier. But I agree with you that just in terms of what would an essential worker look like is itself an interesting question. I'll go back and look at that. Thank you.
Thank you.
Mr. Stevenson, while we're asking questions, I'm wondering if you could put up the slide with the two points of summary that you had.
Yes,
that would be great.
I will. My screen sharing privileges were dropped. Let me pop that back up.
Thank you.
Is this the slide you were referring to?
No,
or were you referring to this slide?
the findings. Thank you.
Yes.
Member Brodowski, please go ahead.
Yes, I have a question, and it depends on two assumptions I'm making, and I'm not even sure I'm correct. But if I'm not mistaken, the average age of whites in this area is greater than the average age for Latinos or Blacks. And I don't know how it is for Asians. And so since I also think, without any evidence right now in hand to prove it, that young people are cited more often than older people, did you take into account this problem that I think exists but may not?
I apologize, just to clarify, is the problem that younger drivers are more likely to be cited, and younger drivers is correlated? There are more younger persons of color than there are so again, I agree that is a limitation of this kind of work using administrative data is exactly what you're touching on, which is who is this population? The ideal population that we'd like to be able to get at, and this is to the vice chair's question that he's asked others that I alluded to, if you had infinite data, what would you, or infinite resources, what would you do? Well, as a researcher, I would pay people to sit on the road and just count who's in cars. Because the population that we want to know is the driving population Mountain View. That may also just be different than the demographics of Mountain View. What does seem to be the case descriptively is the following. That question right there presumably should not affect stop decisions per se, in the sense that who a officer is deciding to stop when they can see who's in the car versus when they cannot see who's in the car, if the population is the same at both times of the year, that in some sense is taken care of. It may, however, affect search decisions, and descriptively that does seem to be true. Younger individuals are searched more often than older individuals by the police department as a consequence.
Okay, thank you.
Did that fully answer your question? If not, I can certainly continue.
No, I don't think you could fully answer my question, but
Okay.
I just wanted to get it out to see if you had thought about that, and apparently you have, which is all I needed.
Okay, yes, age is a challenge. There are many, and as I mentioned the last time I was here, and I think it's a very reasonable thing to be skeptical of any of this kind of work, is that one way you could read the summary of these findings or the final report is, well, I think there are simply too many confounders, so things that are affecting the reason why people get stopped in such a way that this effort is not going to help me decide something. My personal view is that we can learn some things from this, but I think if you want to be skeptical, that is a reasonable position. I wouldn't say it's unreasonable, and that has to do with the nature of the problem that we are dealing with. And so it's not, just specific to Mountain View. I would make exactly the same point if, Sacramento was conducting a similar effort.
One more question, Alex. Are you doing this as part of a doctoral thesis?
This work is not specific to my doctoral research. I am a paid hourly employee within both working with the city and stationed within the command staff of the police department. But this work has not as yet tied into my personal research.
Okay, thank you.
Thank you. Member Tang, go ahead.
Can I direct a question towards Captain Canfield and Chief Sung?
I think Captain Canfield, I don't know if the chief is still on.
I'm looking in the attendees list.
He's
Logged
still
in.
here. If Captain Canfield can't answer the question, I can see if Chief Shong is available.
Okay. Well, I think I remember earlier, Chief Sung saying he was excited about like some new like data reporting system that MVPD is going to use. And so I'm looking at Mr. Stevenson's I guess conclusions. Sorry, that's my cat. His conclusions about data transparency. And so I'm wondering if there are advances in like the data reporting system that are outside of like this new law that just got passed, or if the advances are more just in line with the new law.
Oh, I was going to answer, but I see that the chief is here.
Hi, so when I got moved to a panelist, I think I lost the first 25% of that question. Would you mind repeating that?
Yeah, sure. So I think you were during the report talking about like excitement in a new like stop data reporting system, and I'm wondering, given what Mr. Stevenson has said about the new RIPA law for like transparency, I'm wondering if the new advances go past like what has been passed in that law, or if they're just more in line with what the law mandates.
I see. So for clarification, the software program I was discussing when I presented the report was actually would be more for tracking use of force in complaints and compliments. So it's a little bit different. There are other products out there, I think, once the RIPA collection has started that we would be evaluating. So that remains to be seen. It's very logical to make the presumption, though, that whatever product we chose should be kind of forward compliant to everything that RIPA is collecting, and in an ideal world would allow the public to kind of an open data type of approach to look at that.
Thanks for clarifying.
Vice Chair Frank, please go ahead.
I just had a quick anecdote that Alex, I did not get a warning. I actually got a ticket twice, just so you know. And it was in the downtown area. And I noticed in your data, you had mentioned that a lot of the traffic stops were in the downtown area, right?
Yes, just to be clear, I didn't suggest that you only got a warning. Correct?
I know. I'm teasing. I'm just.
Oh, okay. That is where yes, yes. Most occur in beat 1 and beat 4, and that kind of right on. And the downtown area is the primary place it seems that most traffic stops occur. That, of course, you can slice observation. You can slice this data a lot of different ways. And so, if you slice it by time, one of the things that I believe kicks out is, perhaps unsurprisingly, you get most traffic stops around rush hour, but in certain areas that might be considered quieter areas, later at night, you see fewer traffic stops, and places where there are more people and more activity, you would see more.
Yeah, both were at night. Yeah, both downtown.
Yeah.
And I have to say, I deserve them both. So that's all. Thank you.
Thank you.
Member Langton, is your hand up again, or is it a remnant from before? I wasn't sure.
Yeah, it's up again.
All right, why don't you go ahead?
I guess it's probably more of a comment to anybody on MVPD. Alex has made a point about that basically warnings are not tracked. And in particular, in my experience and the department I worked on, the state police in Massachusetts, it was a similar thing. I could write a warning and it would just go in the trash. It wasn't even really on an audit sheet. It was listed on an audit sheet as that I wrote a warning, but the data wasn't really tracked by, the DMV. And honestly, it was utilized by officers in the department as a way to potentially change citations that were written as a real citation, but they held on for like a couple of days. And there was kind of a loophole where you could just kind of change it to a warning. And so honestly, I think tracking warnings is something that really should be done. Is there any talk of that within like the state of California? How are warnings processed here?
So Member Langton, in short, no. The DMV does not keep like a point system like they do for moving violations for warnings. In the past, and probably well over a decade, we had a warning system that could be entered into our internal record system, and an officer would be able to access that and see that somebody had had a warning. It may be closer to a decade and a half, and that could reasonably be used for an officer and their decision making if traffic enforcement is meant to change behavior, if a previous warning hadn't worked, if a citation would be more effective in changing driving behavior. You had brought this up before. I can't remember if it was in MVPDX or if it was in on the board.
I don't remember either.
I like it a lot.
Yeah.
And it was well received. So been discussing it with members of the traffic team. And there's certainly an interest in reviewing it. It has not gone to a full work group to see all the stakeholders and what it would look like internally. But it's certainly something that I think is valuable and worth looking at internally for us, both from a transparency, but also for just giving us more tools and more abilities to do our job better. But in reality, I don't think that it's in any short term, it would be easy to make the state have an interoperability level through the DMV or anyone else on warnings alone.
Yeah, okay. Thank you.
Member Brodowski, your hand's up. Please go ahead.
No, I must not have lowered it.
Oh, okay. Got it.
Sorry.
No problem.
It's not lowering.
Okay. Oh, there it goes.
There. Yeah.
I had two quick questions, or hopefully quick. One is there a way to understand what data when the RIPA law goes into effect in 2022, what the changes in terms of what all is being collected, what those changes are? Is there a way to understand that? And get that to members of this team would be very helpful. And the second question I had for Mr. Stevenson. So I think it was the type of car the person was driving and one other data that was like, well, a lot of these were warnings, and so we couldn't really look and see if there were any I guess practices in if any kind of discrimination came into play, because a lot of these were warnings and we don't track warnings. Is it at all worth looking at when citations were given and trying to track within that group? I don't know if the amount of data is meaningful, but I wasn't immediately sure why that couldn't happen, and why, if just because the warnings weren't tracked, the other data that was available couldn't be analyzed.
Yeah, thank you for the questions. To the first one, yes, there is now a somewhat large number of materials that exist for RIPA, trying to sort of both deal with police officers explaining what they will need. But there's also something called the RIPA data portal. And I can interface with the board at the board's convenience and in a medium that's convenient to provide that information, so the board will be able to see what they're referred to, I think by law, as data elements, but what data elements are going to be tracked. And happy to provide some discussion on that. For the second question, let me be clear, because I clearly wasn't, and this is my fault. The thing that we'd want to know is the make and model for every vehicle. So we want to know the make and model for people who, well, are never stopped. Our ideal population is we want to know everyone who's on the road at all times. And as we move farther and farther away from that ideal population, we start wondering if there are potentially threats to inference in our ability to understand why is something happening. So if we only look at citations, what we sort of need to believe for these tests is that the individuals who are cited and all of the attributes about those individuals that are cited are exactly the same, at least the underlying ones, except for perhaps the severity of the violation in some sense, as the individuals who are warned. That is not an assumption that I personally would be willing to make, in that I think it's very reasonable to believe that the people who are cited are different in potentially important ways. From the question of discrimination, one worry that we might have that we see sort of nationally is officers cite certain individuals, but give other individuals warnings. And in this case, they do that perhaps based on perceived color of skin. So they're more likely to give a citation to a person of color, let's say, than a white individual, perceived white individual. And to be clear, I'm not making this point in any way about the Mountain View Police Department or any individual police department, just the general thought experiment that we'd be thinking about. Well, in that case, if we look at the citations and sort of look at the difference of citations, if we think what would require a white individual to get into that data set, they'd have to be doing something like especially bad, because at the margin, the way that we were thinking about that data generating process, who does an officer cite versus who do they warn, they're more lenient in that case towards one group rather than another. So that makes that inference, once we get to that point, in some sense, our data has been corrupted. That's the problem. And that's true. So if we're looking, for example, what kinds of makes and models of cars are cited, well, those makes and models of cars might be in that data set. We could see, individuals of different perceived racial groups driving the same kind of car. But the worry is that the individual who is driving this kind of car and is considered a favored group in some sense, or the group who is not discriminated against, had to have been doing something much worse in order to get into that data set. So in some sense, the fact that they are there is a sign of discrimination. And so you have what the kind of academies would be, you have a biased data generating process. And if you have a biased data generating process, that will create biased outcomes when you run analysis on it. And it's the similar threat, as I said, when, if you want to, I am not going to sit here and say that a skeptical reader could say, like, I don't believe this data generating process is ever free of that corruption. I, as a researcher, I cannot tell you, yes, that's guaranteed to not be the case. But it especially bites the further you subset that data. Does that answer the question?
It does, and it makes me think that the previous comment about tracking warnings has even more merit. So thank you for taking the time to explain that. One last question I had was, and it might be that it's late and I'm jet lagged. I'm trying to remember. Oh, the reason this entire topic came up was that there was a belief, there was data, there was something that said that there was a higher number of people of color that were stopped in Mountain View. And I think that's how this whole topic came to be. Can you, Mr. Stevenson, or someone else remind me what data point that was? Where did that come from? Because the findings aren't really reflecting that. So I'm trying to figure out where the original source of information, what that was.
Chair Iyer, that might predate Mr. Stevenson's time.
Okay.
I think if I recall, there was a lot of going off the annual report data. It was maybe, if I recall, is the presumption that using the annual report stop demographics and then overlaying that with the demographics of Mountain View. I think if I recall, that was how the calculation came out.
Okay, I see. Thank you. I kind of had lost the thread with all of this of like, where did that start from? Okay. I'm going to have to go back and look at that as well. Member Tang, please go ahead.
Oh, I wanted to answer your question. The data point was, the chief is right. The data point was gleaned off of the annual report. It was number of stops, and I think also number of arrests. Maybe number of citations. I'm not sure, but
Okay.
definitely number of arrests was in there.
Okay. I think I need to get a hold of that annual report and go back and look at that, and I may have further questions. Okay. Other questions or comments at this point from PSAB board before we open it up very cautiously to public comment? Anything else? Don't see any hands. Brace yourself, Mr. Stevenson, as I go and look at whether there's any public comment. And I can always count on Mr. McKenzie. You're going to geek out on the data with Mr. Stevenson. I know you are. So go ahead.
As a member of Mountain View, as citizen of the city, I always love to hear the presentations from you, Alex. It's clear you thought very deeply about these things and considered it very strongly from lots of angles. If you have a public defense at any point, I'd really enjoy seeing it. But there's one way to be certain that there is no bias, and that's to follow the lead of what Berkeley has done and have police officers not be the people tasked with traffic enforcement. And even before stopping traffic enforcement, we could call for an end to pretextual stops, which is something that I know is done through my time in MVPDX, having heard it from an officer mentioning like, oh, I know of situations where I'll pull someone over, like I'll find something that I can pull them over for because I want to check something else out. So I'd like to, as much as it would pain me to not give you the data that you want, Alex, I think that it would be great if we consider ways to have traffic enforcement not done by armed agents of the state tasked with keeping the peace and enforcing laws. Thank you very much.
You know, Mr. McKenzie, you may not know this, but there's a drinking game based on how many times you say armed enforcers of the state in any given call. So just I didn't know if you were aware of that, but thought you should know. Okay, so with that and my bad humor, I'm gonna see if there's any other questions or comments for PSAB before we let Mr. Stevenson get on with his evening. Mr. Stevenson, I don't even know if you're local right now. It might be some ungodly hour where you are.
I am more local than I used to be.
Okay, all right. I do not see any other hands up. So with that, we want to thank you for your time and your efforts in all of this. There may be some follow-up. How long are you staying around, Mr. Stevenson?
Well, my initial term as the chief, and I understand it, seems to go at least through the beginning of the fall, and then continuing on in some sense is whether or not I continue to be a resource to the city and the police department, because one of the things that is always true, and I think also evidenced on this call, is cities are strapped for resources. And so I always love to be paid, and I think these are very interesting things. As long as my work is valuable, I'll stick around.
Okay. So when I hear beginning of fall, am I thinking mid-September for sure?
Closer to mid-November than
mid-November. Okay. All right. We're in California. We don't have real seasons here, so sometimes it's hard to tell when fall happens. So
yeah, well, it'd be snowing in my homeland.
All right.
So
I hope for snow here too, in the mountains, not necessarily in downtown Mountain View. Okay. Well, thank you for that. It is 10:40. Members of PSAB, does anyone need a stretch break before we move on to 5.4? Everyone okay to keep going? Can do a quick 1 minute if anyone needs it. Okay. All right, then 5.4 PSAB fiscal year 2021-22 work plan final discussion. We're going to receive a presentation from Mr. Gaines and then discuss our proposed PSAB work plan. Mr. Gaines, over to you.
Thank you. I'm going to go ahead and put Chief Shung back to a attendee, and I will start my presentation. And I promise it will be coherent.
Well, we'll be the judges of that, but okay. I appreciate your optimism.
I can't find change role to attendee, sorry. Okay, getting there. Just want to share my screen. All right. Good evening, everyone. So now the long-awaited PSAB work plan discussion will begin now. We've heard a number of presentations, and in fact, we've had a number of meetings which have kind of led up to this moment where myself and Captain Canfield are asking you all to recommend a work plan for the remainder of the fiscal year through June 30, 2022. We've explored a number of topics so far that may be feeding into this work plan. And last meeting on July 22nd, you all proposed 15 potential items on the work plan. In order for this work plan to become official, the city council needs to approve it. Along with every other advisory body, you're submitting a work plan that the city council will review and consider and approve on September 22nd. So at last meeting, you guys proposed 15 potential work plan items. And it's important to note that while we have a lot of ideas or a lot of items that we can explore, and many of them are worth exploring and important topics, we only have the capacity to do so many things in a given work plan, both from the PSAB's capacity, with you all having to often have subcommittees to tackle an issue, as well as staff's capacity, us preparing reports and doing the background research, as well as supporting subcommittees. We only have the capacity to do so many things in a given year. So I'll say it again, we recommend that this work plan include no more than 3 to 5 items, just because that's what's feasible for all of us to really take on. To assess the work plan items that the PSAB proposed last meeting, staff reviewed the work plan items and was really trying to determine whether or not, one, whether they fit into the scope of the PSAB. We also wanted to make sure that anything that was proposed fit the city council goals or their existing strategic priorities. The more likely that things fit council's priorities, the more likely they are to approve them as a work plan. But we also wanted to make sure that anything you proposed was consistent with existing city policy and that it's not duplicating any existing city work plans or initiatives. And lastly, we just want to make sure that it's feasible for us to implement, again, capacity constraints. And we also, like when we're recommending a number of items, we end up recommending 4 items, is really also asking what can be completed in a timely manner that can address timely issues. So that includes things that we're already working on, we've already began to ask questions about, and the city has already put in motion. So following our review of the proposed items, staff categorized each item into one of 3 classifications: recommended, which there are 4 projects that we're recommending, projects that we need more information, which were items that when Captain Canfield and I began to evaluate, we just decided we didn't really understand fully. And in order for us to make a full recommendation, we need further information. And then there was the third category of items is that items that we don't recommend for various different reasons. The majority of the items that were proposed fit within the scope of the PSAB, and they also support existing council priorities, and many of them don't duplicate existing city efforts. But we still have a limited number of items that we can undertake in this given year. So staff is recommending 4 items. I do want to note that a number of the items that were proposed and during our evaluation, we were wondering, well, maybe this is more of a request for information than it is an item that needs to be added to a work plan. So you all can clarify it today during discussion, but if we're assuming that these are items that are just requests for information, the most appropriate process to undertake those items is through it being added to a future agenda, which can occur through any PSAB member just proposing it to the chair, and the chair working with staff to determine that we're able to undertake that project given existing agenda items, and that staff has the time to prepare that. So some of the projects we're not recommending, we're kind of requesting that you all clarify if they are informational items.
Wait, Mr. Gaines. I have a feeling that you think that you are sharing your screen, but we are not seeing a presentation. I have been following along on the memorandum, but if you have been switching slides, we have not seen them.
You're not seeing my slides? I told you it's the
Correct.
Apologies.
No worries.
I'm normally asleep at this hour.
And we appreciate your sacrifices, especially at this hour.
I was explaining clearly, though, correct?
Yes.
This is going on YouTube's greatest hits. All right, let's try it again.
Right behind me, and it looks very tempting.
Okay, can you see my presentation now?
No. Nope.
It's literally telling me I can't share. Screen sharing has failed to start. Okay, so sorry, folks. I don't know what's going on with technology, but I will continue to present and you won't be able to see. Apologies, but Zoom is not allowing me to share.
Can one of us share the screen while you chat?
Say that again?
Can one of us share it? Can the chair share it from her computer?
I can try that. Can you guys see now?
Yep.
Yes.
Is it my notes or is it the presentation?
Says recommended work plan.
Notes, we can see the notes. There we go.
Yeah.
Now you cannot see my notes.
Right.
Correct.
All right. So I told you about 3 categories. Apologies again. Our recommended work plan includes 4 items. Those items are 1, to examine and recommend and make recommendations related to the Mountain View Police Department's SRO program. The type of activity that this is information gathering and sharing, as well as doing analysis to make a recommendation to the City Council. You all have been working on this for the last 2 months. I've already formed a subcommittee. Its recommendation is just to continue that work, make those recommendations to Council, continue conducting surveys and doing interviews, as well as considering other information such as whether or not the terms of the existing memorandum of understanding between MVPD and Mountain View Los Altos High School District needs to change. The second recommended project is to develop and implement follow-up actions related to MVPD Research Fellows Analysis. So Mr. Stevenson just presented and he had a number of recommendations included in his presentation. The PSAB may want to take on some or one or more of those recommendations, whether that be evaluating and reviewing the data generated from RIPA stops, or exploring ways to make MVPD data open and available to the public, as well as advising the police department on ways to partner with the community to determine additional data sharing that may be useful. The third recommended item is to explore alternative responses to persons experiencing mental health crises. We heard today from Santa Clara County Behavioral Health Services, as well as Captain Jaeger, about the various different mental health approaches that are available to the city, and we're implementing those. It would be impactful for the PSAB to stay involved and review those processes and inform those processes, whether that be making recommendations to the county mobile response or the trust program, or making recommendations to the behavioral services unit implementation. And the final recommended project that we are recommending is that the staff provide quarterly updates to the PSAB on the number and nature of complaints that MVPD receives. The purpose of that was that really in response to this body's request to create a process for the PSAB to examine the complaints that are filed against MVPD. There wasn't really a large number of complaints. There is not a large number of complaints. And also considering City Council's formation of this PSAB, they didn't decide that the PSAB would review complaints. So we wanted to help the PSAB better understand and the public better understand the types of complaints that are made against MVPD and the volume of those complaints. And from there, the PSAB can decide in a more informed way whether or not an additional layer of oversight needs to occur over complaints. Items needing more information. I won't go over all of these. You have them in your report on, I believe that's table 2. And there's also items that are not recommended, which are on table 3. So to approve this work plan, the process that we propose is for you all to decide whether or not you accept the 4 items that staff has recommended as the work plan, with or without modifications, or also to decide whether or not you'd like to add some of the work plan items that we did not recommend, or the ones that we said need more information, which also are not recommended. If you'd want to add any of those to the work plan, please let us know. But in doing so, for every item that you recommend, affirm that the listed scope is defined correctly as you wish. Also ask that you affirm the general approach or in a timeline for that item is correct. And then finally, just vote to approve the work plan. So we're going to essentially develop a list of 3 to 5 items. It could be the 4 items that staff has recommended. It could be different items, and ultimately to decide that that is the work plan. If there are more than 5 items that this body wants to look at, we will be asking you all to vote to prioritize the top 5. And those top 5 will be those that we submit to council as your recommended work plan. And next steps is on September 28th, the City Council will review the PSAB proposed work plan along with the work plans from other advisory bodies and approve it with or without modifications. And that concludes this presentation. I will stop sharing and yield to the chair.
Thank you, Mr. Gaines. I appreciate that walkthrough. I'm going to open it up for PSAB members. If does anyone have any clarifying questions at this point? Member Brodowski, please go ahead.
Yes, I think it's slide 5 that you had up about 2 seconds and I didn't get a chance to read it all. Could we see that again?
Now with this slide up, it might be hard to see people raising hands, so you might have to speak up.
Is this slide 5? Yes, this is it. Okay.
Okay.
I've seen it enough. Thank you.
Okay.
I hope everybody else got it.
Well, it's Member Brodowski, it's probably helpful to correlate slide 5 with table table 2 that is in our packet. That may be helpful if you want to read in more detail.
Yeah, thank you.
Okay. Other clarifying questions from the board at this point. I had one question, Mr. Gaines. Should an item on the work plan finish earlier than expected, say item 2? Do we have an opportunity to update the work plan? Is this a dynamic document?
So the council policy has a method or a process for making additions to the work plan throughout the year. And that is essentially the PSAB proposing additional work plan items and working with staff to determine whether or not staff has the capacity to undertake those items. And then we would make a recommendation to the city manager, who has the authority to approve the item. If the city manager does not approve an item, the PSAB then has the authority to ask council to look at it again.
Okay, thank you for that clarification. Any other questions or clarifying points at this time? Member Brodowski, your hand is still up, but I'm not sure if that's a remnant.
No.
Okay, all right. Vice Chair Frink, please go ahead.
When you're saying clarifying, are we commenting on what these items are?
I think clarify on whatever you need to understand further, because then afterwards we're going to actually have a discussion about whether these are the correct 4 items to go forward with, or do people disagree and that kind of thing. So ask anything at this point that will help you participate fully in that discussion.
Very well, thank you. I'm good.
Okay. All right, good. Then you can explain it to all of us. Glad you're all set. Okay, any other questions or clarifying comments at this point before I open it up for public comment? Okay, so let me open it up to, am I doing this right? Would any members of the public like to make comments on this item at this time? Mr. McKenzie, what would you do if I just pretended I didn't see your hand? Oh, you know what? I am interested in what you have to say. I'm just giving you a hard time. Please go ahead. Mr. McKenzie?
It's my fault. I'm trying to
remove
him and allow him to talk. Okay.
It would probably send you a text message and say, "Oh, come on."
Why did I ever give you my number? Okay, anyway.
And thank you for the great report, Melvin, much appreciated. I'd just like to, as a member of the public, make a comment about scope of 2 of the proposed items and how they relate to 2 items in table 3, actually, that are not proposed. But as I mentioned earlier, the exploring alternative responses to persons experiencing mental health crises. As we heard earlier, it sounds like at the dispatch level might be one place of interjection for finding out who is the best person to go. And I know explore where it is appropriate to have non-sworn personnel respond to calls for service was not explicitly called for. It feels a little intrinsically related. So I'd hope that within the scope of alternatives to mental health crises, we could consider where it's appropriate to have the police respond. And also on the receive quarterly updates on number and nature of complaints related to that for information sharing to raise community awareness as a member of the public. I understand that we can't comment on a current lawsuit that's ongoing, but I'd be interested in understanding the ways that Mountain View handles lawsuits. If I remember from MVPDX, it was something like a joint insurance program with several cities that we all go along with, but I feel like that might be thematically related and could be defined as part of the scope of item 4, and I would appreciate seeing those things. Thanks a lot. Look forward to the discussion.
Thank you. Mr. Brown, go ahead. You have 3 minutes. But you don't need to take it all up.
Oh, I'm going to take every last no. Melvin, I just wanted to say that you, sleep deprived without slides, were more clear, concise, and coherent than most presenters after their first cup of coffee in the bright light of day. And I think that you did a really good job, and I appreciate. I trust more that staff is capable of deciding what is and is not possible to do with time. And having you at the helm makes me confident that this is going to go very well.
You missed the opportunity, Mr. Brown, to call Mr. Gaines a treasure.
Mr. Treasure? Mr. Treasure is a treasure, yes.
Thank you. Okay, let me check and see if there's any other members of the public. No, we're slowly losing people. Okay. So before we get into the discussion on the work plan, are there any other clarifying questions or comments that anyone has to make from the PSAB board? Then let's go into the discussion. So based on the process Melvin described during his presentation, I'd like to ask if any PSAB members would like to discuss. Okay, we'll take these one by one. Clarifying the scope, approach, or timeline of the recommended projects. Let me read them all to you, and then we'll see which order we're going to do them in, actually, because I'm thinking as I'm going along, I might change this. So we need to look at what the recommended projects are and see if there's any modifications we want to do to them. We need to decide if we want to modify the projects list to begin with, right? Does that make sense? So what is the project list? What are these maximum 5 items? And then what is the scope, approach, and timeline of each of those, right? And are there any projects that we don't think should be on the list, right? Okay, so let's figure out the best way to do this. I might go one by one and ask you, number 1, you've seen the 4 projects that staff is recommending. Do you agree with those? Okay. If you don't agree with them, what do you want to remove? What do you want to add? What do you want to change? And then of the projects there, right? Actually, I'm going to take that as a whole second round of, do we need to modify the approach or the timeline? Okay, I'll take that as a second step. So everyone, I'm not as clear as Mr. Gaines, I'm sorry. And I need a script to even get through this stuff. So, okay. So let's start. Member Langton, I'm seeing you on my screen. You have your hand up. Do you have a clarifying question, or are you raising your hand so I can start with you?
I guess I'm raising my hand. If you could start with me, I guess.
Okay.
Yeah, I don't need much more clarification.
Okay.
If we're getting into the next round, I have
Okay,
thoughts.
so Member Langton, I'm just going to stick to my first question, and then I'm going to do a second round with my second question. Are you comfortable with the 4 items that staff has recommended? Do you want any changes in terms of the projects that are recommended for the work plan?
I'm not muted. Yeah, I'm very supportive of Melvin Gaines' staff and just the office of the mayor in their recommendations on resources, and I don't have any objections to the 4 items he put forward.
Okay, thank you. Member Tang, I'm going to go to you next. are you comfortable with the work plan items that are recommended? Do you have anything that you would like to see changed?
I think for the scope of our first fiscal year and just like the timeline that we're working with, I don't have any objections to the items that are listed.
Okay. Member Sandhu, over to you. Same question.
I'm for it. I'm happy with the proposal of the work plan the staff has recommended.
Great. Okay. Member Brodowski, what say you?
I accept it as it is.
Okay. Thank you. Member Wang?
I just kind of have a question about the second one in terms of the analysis of the traffic stop data and the follow-up. Maybe my brain is just not working. But I'm kind of wondering, based on his conclusions that he's reached, which I think kind of showed that there is not much visible discrimination, or like what we could do as PSAB on that item. I guess like his recommendations seem pretty recommended.
Yeah. Okay. Hold that thought, because I will actually want to dive into that a little bit more in terms of what we expect that to look like. And I have some thoughts on that. So, but other than that one project, are you comfortable with the other three as they are listed right now? Okay, great. We'll circle back in just a sec. Vice Chair Frank.
I am not good with all four. Again, and I come at this from a color of my father's experience, who had throughout his life was steadfastly against exploring or listening to or entertaining any complaints. The department has a well worked out process for handling complaints. The city manager's office has a process for that. And if there's anything that goes beyond whatever the normal complaint process is, it'll be a legal issue then, and we can't discuss it anyway. So it's just, and I hesitate to allow this body to become a complaint board. It's just like, that's not what we're here for. I think we have bigger fish to fry personally.
Okay.
These three I think are fine.
Thank you. Is there anyone I did not call on? Okay. So let's take each of these individually and talk more about them. So Khalid, I'm going to start, since you just stated your thoughts on item 4. Let's start there. So the item is to receive quarterly updates on the number and nature of complaints. And so the idea here is, I think it builds on the transparency that MVPD stands for, to build community awareness. So the proposal here is to create a process for PSAB to examine complaints against MVPD, PSAB members had proposed creating a process to examine complaints, but that is not recommended because of legal restrictions. However, there is an opportunity for PSAB to receive a quarterly update about the number and the nature of complaints, to understand more about volume, types of complaints, and resolution of the complaints, with, again, the idea of building on this transparency. So Vice Chair Frink, it sounds like you even think perhaps that quarterly update at this high level may be a step too far?
Yeah, I just feel like they've got a strong system for that transparency already. And again, at some point you get into, why is it? I just feel like we should be more focused on policies looking forward rather than looking backwards at things that have already been done. And not involving ourselves in becoming, a complaint complaint box.
Right. Okay. Member Tang, what do you think about this?
I'm losing my focus. So pardon me if I am saying things that have already been said. I just wanted to clarify that, well, one, I'm not particularly married to this idea, so I'm not like super defending it, but two, within I think the not recommended items was the idea to review, like examine complaints, like board member Brink is saying. So I think I think this work plan item is not necessarily to like continually review them and like make decisions on them, but just like informationally. Once again, losing my focus. Forgive me if that has already been said.
No, you're good. You're good, Member Tang. Thank you. Member Langton, you want to chime in here?
As far as the complaint component, I can agree with Cleve that, you know, yeah, are we a complaint resolution board? But I also can see the standpoint of the city council or the mayor's office and potentially us seeing this high level summary and the public of Mountain View. And, you know, and I think that's kind of also important, that if the people that Tim McKenzie, you know, who are, you know, the people that watch these meetings and, you know, and review it when it's put up on YouTube or whatever, are going to kind of understand Mountain View Police Department as a whole and how many complaints at this high level are given, and it could stimulate some community action. And I do see some value in it. I'm not really opposed to it.
Other thoughts, Member Wang? No, Member Brodowski?
Yeah, I think that we ought to be seeing a list of complaints and what's been going on. I think that's part of our reason for existing, and it has to do with the transparency that the police department ought to have.
Member Sandhu?
I think it's good to have take a look at what the reports are. I mean, this is our first work plan. As we progress, we can get into the nitty gritty of, you know, one thing for sure, I agree with Cleve. We do not want to be a repository for complaints at all, because you'll be inundated. Being with HRC and doing police profiling, you were there until 1 o'clock in the morning, just listening to complaints. So as it is, I would accept what it is. There's a good out of that item number 4, and you know, that's where I stand right now with.
I'm seeing both sides of this. My feeling is to maybe, you know, I'm not sure where the first quarter, where that lines up. Would that be September, Mr. Gaines, where we get our first report?
It'll be the first quarter of this fiscal year, yeah. So, yeah, end of September. The September meeting is when we would be working to provide an update.
Okay. So it's hard for me to say until I see something. So I'm wondering, what Vice Chair Frank, how you'd feel about maybe trying it out in September, kind of seeing where we are.
I would be more interested in being an informational item on an agenda once, rather than it being a part of our official work plan for me.
Oh, I see. Okay. Got it.
So through the chair, to clarify, it being on a work plan is just that it is staff work to not only just provide you the numbers, but to be prepared to provide a little bit more context. Obviously, we're not going to talk about every complaint, but to be able to respond beyond, there were 3 complaints against MVPD, and leave it at that. We can discuss kind of what the types of complaints were. And the idea behind that is, frankly, when we hear concerns about people wanting to know about complaints, we just want to, you know, be more transparent and to allow people to know these are the types of complaints that are made against MVPD, to help people better understand what types of complaints there are, because it's there's one thing to speak in generalities and just say, well, I want to know about the complaints. And maybe the complaints were minor. Maybe the complaints were a complaint from an officer to an officer. Maybe the complaint was somebody got a ticket that they didn't agree with. Those may or may not be issues that this body would really be concerned about. But right now we don't know. This body doesn't know. They just know that complaints occur, and some on this body want to know more about complaints. So where we'd like to begin is with providing greater context of the number and nature of complaints that we receive, and that we're hopeful will help this body and the public understand more about the types of complaints that are made against MVPD. And if this body or the public decides that they want greater oversight in complaints, that can at least be a more informed decision.
And what I'm hearing is that it's on the work plan so that we know that staff time is allocated for it, even if it's once a quarter. Because we could try to just do it once a quarter, but then, who knows if Melvin's, Mr. Gaines and Captain Canfield's already over full plates would allow for that. So this way the time is budgeted is kind of how I'm understanding it. My feeling is I'd like to try this once in September, which I guess would be the first one, and see, kind of evaluate it then and see where we at. We can always pull something off of the work plan if with the city manager's approval, I guess. And if we're like, this is not a good use of anyone's time, we could make that call at the September meeting. I'm wondering, Vice Chair Frank, if you would be amenable to that sort of compromise.
I am not, but you guys, this is a deliberative body, so I am one who will go along to get along, but I think it's a fruitless effort, personally.
Duly noted. All right. It sounded like everybody else is at least interested in trying it out, so I think we're going to go ahead with number 4. But keeping, you have the right to say, I told you so next month.
No, I there are 7, 8 amazing brains on this board, and one guy having an opposing opinion does not make me right. Even, I think that as a board, if we decide that we should do something, then we will all together decide to do it and do it really well. So I'm good with it.
Okay, thank you. All right, so I'm just going to work backwards, and then Member Wang, we will get to number 2 and talk a little bit more in detail. So item 3 is explore alternative responses to persons experiencing mental health crises. I just the scope of 4 to 3 is kind of unsettling. 3 is huge. So the type of activity is information sharing to raise community awareness, providing input and recommendations. And we already heard from the public earlier about some of the ideas, consolidation of 911, not just the public, I'm sorry, the public and the board, consolidation of 911 dispatch to all of these different possibilities, clarification on whether youth is served or not having non-sworn officers attend these calls, there were lots of ideas that already came up, and I imagine there will only be a few more. So I'm very comfortable with this one. I'm a little intimidated by it, to be honest. I wanted to open it up and see if there's other comments on the way this is described as item 3 in the table that we're looking at. What do people think about the way this is? Is anything missing? Does anything need to be removed? Thoughts?
I like it as is. It's meaty and fun. Let's go.
Okay. All right. I think the building community awareness will be an interesting task for this board. The way that's written here, I have questions, but not right now, but it'll be interesting to see how we take that further. All right, so everyone good with 3 as is? All right, let's work our way backwards. Number 2, and Member Wang, you had some questions about this. So this was develop and implement follow-up actions related to the research fellows. And Member Wang, would you mind repeating your observation so that we're all refreshed? It's top of mind again.
It was not very eloquent, but okay. Kind of wondering, I guess, how we as a board could implement the recommendations that were made, or build upon them. I think that based on the data he also has already made some pretty, thoughtful recommendations. And I think quite a few of them, I don't know how we as PSAP would be able to, I don't know, do it.
Well, there was a lot about opening up data, making it transparent, connecting with the community to talk about data, data sharing. Thoughts from this group? What are your initial takes of, do you feel like we would have the ability to influence that? Member Brodowski?
Well, I think that we probably have an awful lot of information right now, but that doesn't mean we should take this off the calendar, because just the fact that we've listened to it and reviewed it and have seen that there's no recent reason to think that there's a lot of racism behind traffic stops, doesn't mean we can't follow it up over the years. We're on here for 2 or 4 years, so we've got some time to work with it. And I don't see any reason not to have it here, because this would be, let's say, the first place where there would be an evidence of racism in the police department, if there is any. So I think it's a good thing to leave. It might be something we don't spend a lot of time on. That's okay. We can use that. We're going to spend more time on the other things.
Okay, thank you. Member Tang?
Yeah, I think as a data nerd and someone who's been in the sciences, it's important to note in statistics that just because for this particular test and this particular set of data, like just because it says there's like no conclusive evidence, that doesn't mean that there's no bias like ever. It just means that for this particular set of data, for this particular test, like that he didn't find it for that, that there wasn't evidence for that. And so as more data comes out, or as more tests are done on data, I think it's still important to review that. Not that I like want to go out and like find something, but like the scope of what you're looking at and the way that you're looking at it is very important. And you in science, you never prove or disprove something. You always just get more evidence to support your hypothesis or more evidence to not support it. The null hypothesis that there wasn't any bias wasn't rejected this time. And that's just another part of gathering more evidence. So, I mean, I think it's still a work item worth keeping.
I agree. You're muted again.
Darn it. Oh shoot, I didn't get it fast enough. I was saying, Member Langton, you wanted to chime in, and thank you, Vice Chair Frank, for stepping in.
Yeah, I agree. We have a lot of smart people here. I think, yeah, we shouldn't necessarily like disavow everybody's recommendations and the individual dissenters, whoever they might be. But I also really feel this is the first time we've done this as a board. And I really, in my eyes, I kind of defer to the mayor's office and the city council and Melvin Gaines staff, and kind of like getting our feet wet with kind of their recommendations. And yeah, I'm just really supportive of the recommendations he's made.
From my perspective, I think looking forward and ensuring that the data that we collect, that is collected going forward, is reflective of the types of comparisons we want to make is really critical. We touched on maybe tracking both warnings as well as citations. That might be something that we want to look at further. So, I tend to want to keep it here because I think there's definitely things that we should be influencing in terms of data collection going forward. So that's kind of on my brain right now.
Can I just ask, Captain Canfield, if you require an officer to note a warning, that's a piece of paperwork. And if they got to do that piece of paperwork, might they just do the citation, like go the full Monty?
Well, I think, so just for clarification, when an officer makes a traffic stop now, they are required to denote on our CAD system, our computerized automated dispatch, what the disposition is of the stop. Basically, they do have to put in if it's a citation, arrest, or a warning, but that's not tracked to a human being. And I can't speak to what Alex, the data he did on those specifically. I don't think that a simplified form that the officers have some say into how it's created will create a burden to where that they will be more inclined to write tickets or less inclined to make traffic stops. I think it'll be a value personally. Okay, I didn't want to do any harm to the. I think it will do good and not harm.
Yeah, we don't want to hear a year from now that there was bias because they had to fill out the form and that's why they gave more citations or something like that. So I'm not a data nerd, nor do I want to become one. So let's figure out how to simplify this. So, okay. Any other comments on item 2? Member Wang, are your concerns somewhat assuaged?
Yes, I think I just wanted some examples of things we'd work on, and yeah, I'm totally on board.
Cool. I know exactly what to assign you. So good. Okay, so working backwards, we're on number 1, examine and make recommendations related to the MVPD SRO program. So we actually have to make some specific recommendations to the city council. And I know the subcommittee is hard at work at this. What's our timeline, Mr. Gaines, again, on providing an SRO recommendation?
Working for this body to make a decision by November so that a recommendation can be made to the council.
Okay.
The council is targeting a study session before the end of this calendar year. So if we make a recommendation in November and they have an early December study session, that would be ideal.
Okay.
We can finish earlier if possible, but no later than November.
No later than November. Okay. It was a good point about that the subcommittee that's looking at SROs actually didn't have a slot on the agenda. So I had I didn't even think about that because there were so many other things for us to discuss. Does it make sense to wait until September for the next update, or does this body need to hear from the subcommittee before then? I'm not sure how much progress has been made since the last time we received an update.
If you want a general update, non-agendized, we have space to do that. And I mean, we're not going to discuss it, but one of the subcommittee members can give a brief update on whatever has occurred over the last month.
Okay.
It doesn't necessarily have to be agendized, but if the public is asking, you're trying to accommodate a public request for the ability to provide feedback on that particular agenda, on that particular item, it would need to be on the agenda.
Okay. So what you're saying is I could ask for an informal update in the next section.
Yes.
Okay. but we will not take public comment on that, but at least we'll hear from it. I have to be honest, with everything that was going on, that making sure that was on the agenda was something that slipped my mind. It won't happen again. So, okay, so prepare subcommittee for the next section. But okay, is there any other comments or suggestions for item 1? Member Brodowski, your hand's up, but I don't know if that's a.
Yeah, it's real.
It's real. Okay, good to know.
Yes, this is clearly the hottest button issue we have, so we have to discuss it. So I think that should be number 1, and it should be accepted as is.
Okay. Other comments on this? I mean, we've already started working on it, so it's there. Vice Chair Frank?
Yeah, I just wanted to say, I think that this should also consider the work that the recreation work that the SRO team and other parts of the department does, because I think that sort of dovetails into the SRO program and their capacity to do community building and relationship building with their constituents. And then also, I think it's also important to sort of find some way to compare, because it feels like nobody quite gets it, how different this program is from other programs in terms of how it does the work that it does, how it trains the officers who participate in it, and how they are in the program. I think that should be apparent in this part of the study.
Okay, thank you. Anything else on the SRO topic? Okay, let's see what my instructions say to do next. Staff will keep track of any proposed modifications. I'm not sure that we have any. We will vote on the projects to prioritize the top 3 to 5 items that we would like to propose on our work plan. If anyone would like to accept staff's recommended work plan, please make a motion to do so.
So moved.
Okay.
I so move. I second.
There's a battle. Okay. I accept all your moves and all your seconds. Thank you. Mr. Gaines, do you need to do a roll call vote, or can we just all raise our hands?
Yes, so from what I heard was that it was moved by Vice Chair Brink and seconded by Member Brodowski. And now and the motion is to accept staff's recommended projects as the proposed PSAB work plan. With that, I'd like to do a roll call vote. Member Sandhu?
Yes. I mean,
I accept it.
Vice Chair Frank?
Aye.
Member Tang?
Aye.
Member Wang?
Aye.
Brodowski?
Yes.
Chair Iyer?
Oh, yes, sorry.
Passes unanimously.
Well, that's I think that's a reflection of the thought that you and Captain Canfield put in, Mr. Gaines. Thank you for making it easy for us to be able to go with it as is. Okay, with that item done, we are on our almost last item.
Captain Camfield has a question.
Yeah,
Captain
perhaps for Melvin, just to clarify, is that in the order already that was proposed, or do we need to numerically order those, prioritize those?
No, so the recommended project list as shown on table 1 of the staff report is what the PSAB accepted, those 4 items. They don't need to be prior, and they're also included a timeline that I believe the body accepted as well.
Thank you. Sorry to delay you guys.
Okay, so the next item is board staff comments, questions, and committee reports. No action will be taken on any questions raised by the PSAB at this time. Do any PSAB members or staff have comments or questions? I think this is the time to ask if there's anyone who's on the SRO subcommittee, if you could give a quick verbal update of what you've been up to for the last month and potentially what's coming next. Member Wang.
Cool. So over the past month, we actually met with Alex Stevenson, and he kind of helped us look over our questions and make sure that we weren't, creating questions, trying to find certain answers so that it was less biased and it was easier to analyze. So we've done that. And then we finalized the questions and then sent them to Nancy for translation. And I think that Melvin is meeting with her on Monday, just to finalize the translation for the ambassadors for the Spanish-speaking community.
Got it. And remind us who the survey will reach.
It will reach students at Mountain View High School, at Alta Vista High School, and all the middle schools in the Mountain View Wisman School District, as well as parents from those areas, administrators, and educators.
Thank you. How many people are you hoping respond to this overall?
Quite a few.
Okay.
Anyone want to add on?
Is there a number that we're trying to reach to make it significant?
Well, there are just shy of 5,000, technically 5,000 students in Mountain View for all the schools.
Oh, in total?
Yeah.
Okay. Does anyone else on the subcommittee want to answer this question?
Just curious if is it 100, 200?
We're going to try to get as many as possible.
Sure.
We are reaching out as a committee. We talked about it. I'm going to reach out to the Mountain View vice president and one of the teachers, and her husband happens to be a teacher there too, who is in charge of the athletics. Get a focus group there and get permission. Maybe I'll spend about half an hour, give them the form, say, here, fill it up, give it back to us so we have them in our hands. Because if you just send emails, you know how they are, they'll probably never finish it. And if you send it to an administrator, they'll just say to the assistant to do it, and it goes by the wayside. This time I'm literally going to sit in there, like a proctor. Okay, fill out this form right while I'm here. That's a little bit draconian, but I think sometimes you just have to do that. That way we can get as much as possible, and then with the outreach groups, with the Hispanic groups, Melvin is working with Nancy and the ambassadors. We'll do that too. So as PSAP board ourselves, we can all chip in, and any avenues you have, take the bull by the horn, and let's get as many people as possible. So if you want a number is going to be tough, but if you can reach 500 people, I think that's pretty good.
Have you guys spoken to the district at all, the MDLA?
Not yet. We got to get permission from them. Yes.
I mean, and for student surveys, will you be on campus? Are you going to offer like a tchotchke or something for filling it out, or
we're gonna have Survey Monkey, right, Janet? And then we go for this ones. I'm going in there physically and having a session with them, 15 minutes during a lunch or something. But of course, with permission from the school.
Okay.
Did Alex not give you guys a sample size to shoot for?
Nah, he did not. He did not. And we didn't ask either. We didn't ask it.
And I mean, it might be good to understand, at what point is it? I guess what I'm concerned about is like you do all of this work and then it's like, well, that's not statistically significant. I don't want to hear that, right? So what threshold do we need to reach to make sure that what we're getting is something meaningful and people can't like throw darts at it? Well, people will throw darts anyway, but you know what I mean.
Right.
So.
Yeah. And if you look at previous things the city has done, like the HRC community listening forums, it wasn't necessarily statistically significant. We're trying to do information gathering the best way that we can, and to provide a open opportunity for anyone to respond and to meet people where they are as much as possible, which is why we're going through different kind of outreach methods. But at the end of the day, if we receive 500 responses, great. We might receive 100 responses. We really don't know.
Right.
But what the SRO subcommittee, who I'm speaking for now, has really been talking about wanting to do is to make sure that they heard the voices of people and gave them opportunities to chime in on this important matter.
Yeah.
This question: Are we making sure that we're surveying people who are actual subjects and beneficiaries of the program, in addition to people who are just aware of it and live beside it?
The existing survey includes questions specifying whether or not the person has received services from the SRO program, meaning that they have participated in a Mountain View Police Department SRO operated program, or if they've had an SRO come speak to their class, or received a home visit, or any of the various different things. That is a specific question, yes.
And we're also reaching out to kind of specific groups and teachers and groups of students on campus who might have opinions that we are also seeking to understand.
Right. Okay. Other, Member Langton?
I would just say, generally speaking, with any type of survey, whether it's from a tech industry or whatever, I mean, a 1 to 5% response is really amazing. So, like, I don't know, I would just be prepared for a small number.
Right. Okay. Thank you.
You just gotta bring our spirits like that, Derek.
I've just been involved with startups and trying to get users and doing mass emails, and yeah, So, sorry, Debbie.
Okay. Any other comments for the subcommittee or questions for the subcommittee, or any other comments, questions in general?
I have one question, or actually not a question, again, a suggestion. I had my kid do a ride along with a police officer a couple weeks ago, and he said it was awesome. And I'm saying it again. If you haven't done it, you should do it. These guys are super fun, and you might get lucky and get to go like on a semi kind of stakeout like I did. So
yeah. I know any excuse to talk about your ride along, Vice Chair Frank. Cool. Honestly,
we could have made a episode out of it.
No,
yeah, I know.
I second that, Cleve. I did it about 8 years or 9 years ago. It was fun with a sergeant, and I think it's time to do it again because now the cars are cooler.
Yeah.
The previous ones look like taxi cabs.
The cars are way.
It's better when you're driving and you can turn the lights on yourself.
My only other request is Captain Canfield would like also an update at the next meeting for, unless you have information. The SROs had some ideas of what they were going to implement in the school year, and I was just curious if any of that has started already in terms of forming a group, in terms of sending out more proactive communication to students and their parents about what they're all about. I was curious if any of that has begun, if there's any sort of response to it yet.
The school year has just begun, obviously, so conversations, but most of the things that we talked about, other than the uniform change that has been put into place, at least a preliminary uniform change, are still in the works. And I'm happy to provide an update on proposed changes and recommendations at the next meeting. And just to clear, our SROs still wear uniforms, but if they're at the high school specifically for that purpose, they're not in their uniform. If they're doing other duties and they roll by the high school, then they'll be in their normal uniform.
Got it. Thank you. Yeah, I know one of the persistent comments has been people don't really understand why you're there, and so I think communication out was really critical. So I'd be really interested in hearing an update on that at the next meeting. So, okay, Member Wang.
Yeah, you just remind me of something. Captain Hill, I'm just wondering, I think a week ago I asked Katie Nelson, the PIO, about having the officers, the SROs talk at back to school night, which was tonight. Do you know if that's happening or is that just something else?
I am not familiar if they're speaking it back to school night. I can't say. I can find out, but I don't know. I know they had hoped to be part of some of the larger school assemblies. That was also to have some conversations about the type of work that they do, kind of tying into the things that the PSAP had mentioned before in the subcommittee as well. But I don't know if they're even having those large assemblies in the same manner based on the Delta variant. So I couldn't say.
Okay, thank you.
Okay. Anything else for this section? Special shout out to Alex Brown and Tim McKenzie for apparently still being online. The two members of the public that are still online. Thank you for being here with us and texting me random things. I appreciate you. If nothing else, I think as of 11:45, we are adjourned.
And if anyone wants to have a great time, let's go down. I mean, of course, without violating the Brown Act, Michael Jackson's tribute band in Redwood City tomorrow at 6 o'clock. And then, you can come to the Eagles afterwards for karaoke on 181 Castro Street. I thought liven up the party that way.
Wow. I like how you roll, Member Sandhu. That sounds
I know.
cool.
We just take the train there, and after 8 o'clock, come back and right to the Eagles, karaoke there, have dinner, and wonderful Friday. I think Cliff's going. I'm going to see Cliff for sure then.
Definitely got
All
someone.
right. Thank you.
All right. Thanks, everyone. 11:46. We are adjourned. Thank you for your patience and your time. Thank you.
Bye.
Bye-bye.